Large. And this is my first remote meeting, so I'm looking forward to it. Thank you for all who are joining us.
Commissioner Ella Scarborough.
Evening, this is Ella Scarborough, and I'm at large.
Commissioner Trevor Fuller.
Good evening, everyone. This is Trevor Fuller. I have the honor and privilege to serve as a county commissioner at large, and I am participating remotely in our first remote meeting of the Mecklenburg Board of County Commissioners in history. Welcome.
We'll move on now to our District 2 representative, Commissioner Leake.
Good afternoon. My name is Dilma D. Leake, and I represent the most powerful district in this county, and that's District 2. I am also remote.
District 4, Commissioner Jarrell.
Good evening, everyone. My name is Mark Jarrell. I've been elected by the people of District 4 to represent them, and thank you for joining us this evening.
Moving on to District 5, Commissioner Susan Harden.
Good evening. Good evening. My name is Susan Harden, and I represent District 5.
And District 6, Commissioner Susan Rodriguez McDowell.
Good evening. This is Susan Rodriguez McDowell participating remotely from District 6.
And for the record, all commissioners have acknowledged their presence for the meeting. Therefore, we do have a quorum. I will ask the following staff to introduce themselves. Clerk to the board.
Good evening, Emily Kunze, clerk to the board.
Our deputy clerk.
Good evening, I'm Christine Smith, deputy clerk.
Our county manager.
Good evening, I'm Dina Diorio, Mecklenburg County Manager.
And our county attorney.
Good evening, Tyrone Wade, county attorney.
So at this time, we'll have our invocation by Commissioner Mark Jarrell.
Thank you, Mr. Chairman. For tonight's invocation, I want to read a portion of scripture from Psalm 46, and I'll be reading verses 1 through 11. God is our refuge and strength, an ever-present help in trouble. Therefore, we will not fear, though the earth give way and the mountains fall into the heart of the sea, though its waters roar and foam and the mountains quake with their surging. There is a river whose streams make glad the city of God, the holy place where the Most High dwells. God is within her. She will not fall. God will help her at break of day. Nations are in an uproar. Kingdoms fall. He lifts his voice. The earth melts. The Lord Almighty is with us. The God of Jacob is our fortress. Come and see what the Lord has done. Desolations he has brought on the earth. He makes wars cease to the ends of the earth. He breaks the bow and shatters the spear. He burns the shields with fire. He says, be still and know that I am God. I will be exalted among the nations. I will be exalted in the earth. The Lord Almighty is with us. The God of Jacob is our fortress. Amen.
If you would, please repeat the Pledge of Allegiance. I pledge allegiance.
Allegiance to
the flag
of the United
States of America, and to the republic for which they stand, one nation,
under God,
indivisible, liberty and justice for all.
Well, that was a little crazy, so we'll have to do something different next time. Before we begin our meeting tonight, there are a few housekeeping rules that I need to go over, primarily to make sure that the public has access, and because of some of our rules that we have to abide by. So if you would just indulge me for a moment as we go over some of these housekeeping rules. First of all, if a commissioner wishes to leave the meeting, please ask for a point of personal privilege. State the privilege so that the minutes can capture the actions and the attendance of each board member. In other words, we need to know how many people are voting who are seated at the time that the vote takes place. If you do have to leave, then when you return, if you would please announce your return as well. Since no one is physically present, when a matter is put on the floor for debate, I will have to call on each commissioner and ask whether or not you have comments. And I would ask that you wait to be recognized so that we don't have what we just had when we did the Pledge of Allegiance. I also would like to suggest that when you conclude your comments, if you would say something to the effect that this concludes my comments, or thank you, Mr. Chair, or however you'd like to end that, so that I will know that you have finished your comments and I won't move on without you having concluded. Of course, if you don't have anything to say, simply say no comments or I don't wish to speak to that matter. I will tell you that this is certainly different for all of us, and we want this to go as smoothly as possible. And you can help us by making sure that your mics are muted until such time that you wish to speak. If you make a motion, I will try to repeat the motion. Please indicate your name before you indicate the motion. If you second the motion, indicate your name and second so that I can repeat that to our clerk to make sure that she has adequate information which is required in terms of identifying who voted for what. For each action, I will be required to do a roll call vote, which means I will call you individually and ask, how do you vote on this particular matter? And at the end, of course, our clerk will state the results so that there's no question as it relates to who voted and how they voted. The first thing I'd like to do is to ask for a motion to add an item to our agenda tonight. There will be a presentation by Mr. Timothy Tibbs. At the end of his presentation, there will be an ask of the commissioners. And so that item was not on your agenda when you received it earlier. So if someone would offer a motion that we add that to our agenda before we adopt our agenda.
Mr. Chairman, this is Susan Rodriguez McDowell, and I would like to make a motion that we hear from Mr. Tibbs and add that action to our agenda. And in addition, I would also like to see if this is an appropriate time to ask for another agenda item, which would be county commissioners' reports and requests.
Not at this time, Commissioner Rodriguez McDowell. We're only dealing with one motion.
Okay, would it be appropriate to make another motion after this one?
I will give you an opportunity to do that after this motion. Okay, is there a second to this motion?
Mr. Chairman, this is Mark Jarrell. I second the motion.
Okay, it was moved by Commissioner Susan Rodriguez McDowell, seconded by Mark Jarrell, that we add an item to the agenda allowing Mr. Tibbs to make a presentation. So at this time, we'll conduct the roll call vote. Vice Chair Powell, how do you vote?
Yes.
Commissioner Cotham. Commissioner Cotham. Commissioner Cotham. Okay, Commissioner Scarborough.
Yes.
Commissioner Fuller.
Aye.
Commissioner Bill Malik.
Yes.
Commissioner Mark Jarrell.
Aye.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Susan Harding.
Aye.
Okay, I think that complete. Did I call on everybody?
What is your vote, Mr. Chair?
Oh, I didn't vote. Okay, I vote aye. So let the records reflect there's 8-4. Well, sorry, because our rules indicate that if you're present at the meeting and you do not vote, it is a yes vote. So let the records reflect that that is a 9-0 vote for that motion.
Yes, sir. It's recorded.
All right. So at this time, I'd also like to move on the first item on the agenda, which is a joint proclamation for Child Prevention Month. And to read this proclamation, now let me back up. Let's first identify items that need to be pulled from the consent agenda. So far, I have the following items that are going to be pulled. Item 056, pulled by Commissioner Leek. 024, pulled by Commissioner Leek. 043, pulled by Commissioner Leek. 047, pulled by Commissioner Leek. 049, pulled by Commissioner Leek. 058, pulled by Commissioner Leek. 060, pulled by Commissioner Leek. 080, pulled by Commissioner Leek. Since we're on that item, is there a motion to adopt all the items that are not pulled?
This is Commissioner Fuller.
Mr. Chairman. Bill Malik.
Okay, it was moved by Commissioner Bill Malik. I think seconded by Commissioner Fuller.
Yes, I do second the motion.
Okay. The motion had been moved and properly seconded. Commissioner Powell, how do you vote?
Yes.
Commissioner Cotham. Commissioner,
Yes.
Was that a yes?
Yes, sir.
Okay. Commissioner Fuller.
Aye.
Commissioner Hardin.
Aye.
Commissioner Jarrell.
Aye.
Commissioner Lee.
Yes.
Commissioner Powell.
Yeah, this is the second time you asked me. Yes.
Commissioner Susan Rodriguez McDowell.
Aye.
And Commissioner Scarborough.
Aye.
And I vote aye. So let the records reflect that it is a 9-0 vote to adopt all those items on the agenda that were not pulled. So at this time, I'd like to move to awards and recognition. Agenda item 056, which is a joint proclamation on Child Abuse Prevention Month. So to read that proclamation, we'll hear from Commissioner Susan Rodriguez McDowell.
Thank you, Mr. Chairman. At this time, would it be appropriate for me to ask for my motion?
I will allow you to do that.
Thank you. I would like to add the agenda item to the for the county commissioners' reports and requests.
Okay, it has been moved. Is there a second?
This is Commissioner
Second, Mr. Chair.
This is Commissioner Powell. I'm happy to second that.
Okay, it was moved by Commissioner Susan Rodriguez McDowell, seconded by Commissioner Powell to add to our tonight reports by commissioners. Okay. Commissioner.
Mr. Chairman, this is Commissioner Fuller.
Yes.
So I have a question. The motion is simply to add that section, or is there a particular item under that section to be added?
Well, under that section, any commissioner who wishes to speak would have the opportunity to do so.
All right.
Are there any other questions? All right.
Commissioner Leek has
Okay. Conducting the vote, Commissioner Powell.
Yes.
Okay. Commissioner Cotham.
Aye.
Commissioner Fuller.
Aye.
Commissioner Scarborough.
Aye.
Commissioner Leek.
I don't know what I'm voting for.
You're voting to add to the agenda Commissioners' reports.
Is that for each or just one?
Commissioners' reports.
Yes, okay.
All right. Commissioner Jarrell, did I get you?
Aye.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Harden.
Aye.
And I vote aye. Okay.
Thank you, Mr. Chairman. Now I would like to move that we adopt the following proclamation recognizing April 2020 as Child Abuse Prevention Month. Whereas children are vital to our state's future success, prosperity, and quality of life, as well as being our most vulnerable assets. And whereas all children deserve to have the safe, stable, nurturing homes and communities they need to foster their healthy growth and development. And whereas child abuse and neglect is a community responsibility affecting both the current and future quality of life of a community. And whereas communities provide parents with the social support, knowledge of parenting, child development, and concrete resources they need to cope with stress in order to nurture their children, whereby ensuring all children grow up to their full potential. And whereas effective child abuse prevention strategies succeed because of partnerships created among citizens, human service agencies, schools, faith communities, healthcare providers, civic organizations, law enforcement agencies, and the business community. Now, therefore, we, Vi Alexander Lyles, Mayor of Charlotte, and George Dunlap, Chair of the Board of County Commissioners, do hereby proclaim April 2020 as Child Abuse Prevention Month and call upon all citizens, community agencies, faith groups, medical facilities, elected leaders, and businesses to increase their participation in our efforts to support families, thereby preventing child abuse and strengthening the communities in which we serve.
Is there a motion to adopt the proclamation?
This is Commissioner.
Move, Mr. Chair. This is Commissioner Jarrell. So, Mr. Chairman.
Okay, moved by Commissioner Jarrell. Is there a second?
Second, Commissioner Powell.
All right, it's been moved by Commissioner Jarrell, seconded by Commissioner Powell. At this time, we'll conduct the vote. Commissioner Powell, how do you vote?
Yes.
Commissioner Cotham.
Aye.
Commissioner Fuller.
Aye.
Commissioner Scarborough.
Aye.
Commissioner Leek.
Yes.
Commissioner Jarrell. Commissioner Jarrell.
Aye.
Commissioner Harden.
Aye.
Commissioner Powell.
Yes. This is the time you asked me. I just want to make sure I'm doing it right.
Yeah, my records are a little off, but
okay. Thank you. Thank you.
Better safe than sorry. Okay.
Oh, yes. Yeah. Thanks.
So let the records reflect that there's a 9-0 vote on that item.
Mr. Dunlap, I need Susan Rodriguez McDowell and your verbal vote.
Okay, I voted aye.
Okay.
Susan Rodriguez McDowell.
Just for the record, Mr. Chairman, I did make the motion before I started reading. But I also vote aye.
All right, thank you.
Thank you.
All right, so this time we're moving to item number 033, which is our public appearance. Madam Clerk, do we have any speakers tonight?
Yes, Chair Dunlap, we have two speakers. The first speaker is Paresh Patel.
Okay, before our speakers speak, I am required to read these comments. Public appearance, the period during the board's regular meeting that members of the public are provided the opportunity to speak on matters appearing on the agenda. Members of the public who appear during the public appearance portion of the regular meeting may discuss any matter within the jurisdiction of the Board of Commissioners, except for the following type matters. Matter which concerns the candidates for any public office, including the candidates appearing before the board. A request that the board consider funding certain program or activity, either from the current budget or by inclusion in future budgets. Such requests would be made at the board's annual budget public hearing. To facilitate the operation of a remote meeting, speakers wishing to address an agenda item have to be heard during this period at the end of the general topic. The time limit for speaking is 3 minutes. The time limit for speaking is 3 minutes. You will be recognized for 3 minutes to speak. A timer will sound at the end of the 3 minutes. You will be thanked and placed on mute. The clerk will now call on the speakers.
The first speaker is Paresh Patel.
Mr. Patel.
Oh, you can go ahead and start speaking. You have 3 minutes.
Okay. Good evening. My name is Paresh Patel. I'm a small business owner, one of the groups under Carolina Business Alliance, and we are considered as essential to the community. Our group consists of the convenience store owners, grocery store owners, gas stations owner, laundries and dry cleaning, self-employed professionals, as well as small manufacturers. My premises coming to this meeting are we are essential businesses. We need to continue our operation, of course, within limitations. Another premises is there is no permanent arrangement at the county level for essential products and raw materials, including PPEs. My third assumption is that this request is not for funding, so I request the commissioners to relax. Why we are here? Small business owners need the PPE, personal protective equipment, to protect themselves and their family members who are normally the employees, to continue their livelihood. Our business is our bread and butter. Business value is lost when it is not working or it is closed. This is unorganized sector, but it contributes a lot to the local GDP and the tax revenues. County has the authority to make rules and regulations. The county has the resources to make arrangements for essential products, PPEs, and the raw materials. County should create a sub-task group in emergency response team to coordinate the procurement and the distribution of such items to the essential business owners. The examples of what surrounding counties and other states are doing to do such activity are numerous, and commissioners probably may be aware of. New York has done that, Lancaster, South Carolina has done that, and recently I came across about the activities from Cabarrus County. What we expect is not financial, as I said. The availability of essential items, raw materials, and the PPEs in the local level, it should be paid for, not free, at a reasonable cost. We request the county to set up an effective collecting and distributing channel for such products and communicate directly to the business owners or essential business owners. This will help the county to set up a long-term planning and solution for the future.
Thank you, Mr. Patel, for your comments. Next speaker is Uday Bedre.
Okay, Mr. Uday.
Again, I can yield some time to Paresh if he wants to finish off his point there.
There's no yielding of time, Mr. Vedre. You just go ahead and start your 3 minutes.
Okay. Again, I'm a part of the Carolina Business Alliance, which is a minority and women-owned group of small business owners. There is another segment of the business, type of businesses that the organization have with restaurants and small motel and hotel group. And so one of the things that the group wants to, as Paresh mentioned, we are trying to see if we can be of some assistance to the county during these trying times. There's a group of hoteliers that have come forward, and I have the list with me. I can share it after the meeting is over. That they're ready to participate in any county level shelter programs, and the restaurants are ready to provide any food packages if that's coming through the county. And also, I have a couple of questions in regards to these are the concerns again from small business owners around the SBA disaster program and the payroll protection program. So these are all federal level programs that are coming through. Anything that the county is considering at a county level in terms of loans or grants. And the last question is around the question is around utilities assistance through Duke, Piedmont, and local water, anything that the county is considering. And the last one is the business interruption coverage as part of the insurance policy, due to the civil authority enforced scenarios. Has there been any discussion between the county and the insurance companies to ensure those insurance coverage is provided for the business income loss without looking at exceptions and expedite the claims payments? With that, I'm done with my set of questions. And
Okay, thank you to both of our speakers. Let me just share with you that our county manager and her executive team are listening. They have heard your concern, and you will get a response from someone on that executive team. So at this time, we're going to move to item 054, the COVID response update. And for that update, I'll call on our county manager, Dina Diorio.
Thank you, Mr. Chairman. I have several items under my manager's report this evening. First, we will provide a COVID-19 update. I will begin with an overview of several items, both internal to the county as well as external to the community. I will then turn it over to Gibby Harris, our public health director, to discuss our latest case information, as well as other important data points. We are joined tonight by Carl Armato, CEO of Novant Health, Dr. Sid Fletcher of Novant Health, who's the Senior Vice President and Chief Clinical Officer, Gene Woods, CEO of Atrium Health, and Dr. James Hunter, who's the Medical Director of Atrium Health. And I want to thank them for joining us tonight to answer any questions that you may have. After the COVID-19 update, you will be asked to consider 2 programs aimed at aiding small businesses, and also an update on the county's financial position and a preliminary revenue forecast for fiscal year 2021. During the most challenging public health crisis of our lifetime, it's more important than ever to celebrate our public health professionals and the impact they have in our community. This week, we are celebrating the 25th year of the National Public Health Week. And I'd like to take this opportunity to recognize our public health workers. Now more than ever, your hard work and dedication to the community is appreciated. Thank you for your selflessness and for protecting our community by working on the front lines of the virus, helping individuals stay safe and healthy, and for continuing to share information on COVID-19 to flatten the curve. Please know that we are working every day to make sure you have the tools and resources you need to continue to serve the residents of our county. With continued teamwork, we will get through this and we will come out better and stronger on the other side. Moving on from here, as you know, on April 2nd, I received a joint letter from our hospital CEOs requesting that the county assist with standing up a mass care facility with 3,000 beds. The request was based on modeling and data analytics on that date. As you know, the data is revised regularly to ensure we are responding to the most recent conditions here in Mecklenburg County. Since Friday, conditions have changed in some very important ways. First, both our hospital systems have done extraordinary work maximizing the infrastructure within their walls to create additional hospital bed capacity. This additional capacity slightly mitigates the need for additional beds. Second, we have been informed by FEMA and state emergency management that there is no assistance forthcoming to help with staffing, equipment, or supplies for a mass care facility. The federal government is prioritizing how supplies are distributed across the country, and North Carolina is not at the top of that list. So all of the supply and staffing needs would need to be satisfied locally. Finally, it appears that the social distancing taking place to date in the county has begun to flatten the curve slightly. That does not mean we are out of the woods yet. But based on those factors, Atrium and Novant have revised their requests and are asking that we build out a 600-bed field hospital in or near Uptown to provide additional capacity and facilitate the transfer and care of patients close to their primary hospitals. The need for 600 beds as opposed to 3,000 beds assumes that the stay-at-home order remain in place, that it is aggressively enforced, and that is not lifted prematurely. I want to repeat what I just said. Now more than ever, we need every resident in Mecklenburg County to comply with the stay-at-home order. The best possible outcome is that we build 600 beds and not a single bed is used. In terms of next steps, the request for this mass care facility has been sent to the State Department of Emergency Management. The Army Corps of Engineers has begun evaluating locations that might meet the criteria and will make a recommendation as to which is best suited for this purpose. The Army Corps of Engineers will build out the facility, and emergency management and the two hospitals will do the sourcing needed to equip the facility. In addition, we will launch a campaign to encourage healthcare workers across the region to work with our hospital systems to staff the facility. If anyone is watching who is interested in helping, I am asking that they go to the North Carolina Terms website, which is terms.ncem.org. I'm going to say that one more time. It is terms.ncem.org. The acronym stands for Training Exercise Response Management System. There you can register and enter your credentials, and they'll be vetted by the state, and they'll get back to you to see if you qualify to participate. We are working closely with CMPD and the town police departments to aggressively enforce the order. We continue to get requests from various businesses requesting clarity on the order to determine if they can operate. Tyrone Wade, our county attorney, has been evaluating these requests and providing that clarity. As you know, I negotiated revised business processes with auto dealerships and realtors to allow them the ability to do business on a limited basis. We recently learned that the State Department of Revenue has been issuing letters to businesses in our county providing exemptions from the order. I have contacted the governor's office requesting that letters not be issued to businesses in Mecklenburg County, since our order is more restrictive than the governor's. That same request was made by our emergency management office to state emergency management. I have also requested assistance from the North Carolina Association of County Commissioners for assistance on this issue. Some counties in the state have implemented waiver processes to allow businesses to apply for an exception to the order. Based on the case count and epidemiology in Mecklenburg County, we will not be implementing a similar process. We will be expanding enforcement activity in our parks and in our greenways. We will be closing park gates to reduce the number of destination visitors to our larger parks and greenways. Park rangers and additional staff will have to man most of the larger park facilities, which could be as many as 60 locations. The parks will turn into walk-in amenities only. Park and Recreation will work with CMPD for additional barricades to block entrances to the parks and work in partnership for enforcement of parking on city streets near park entrances. Any cars that park in front of gate areas will be towed automatically. Park and Recreation will work with additional law enforcement agencies to assist with non-compliant parking in the towns. We will also use the resources of the Sheriff's Office to provide additional law enforcement support. These actions are the final step before we take aggressive action to close our parks and greenways. I hope that these measures will allow residents to use our facilities, practice social distancing, and stay safe. Mecklenburg County stay-at-home order expires on April 16, 2020. We are working on revising the order to align with the governor's order, which expires on April 29, 2020. All other aspects of our order should remain the same. Again, if we continue to aggressively enforce the existing order and every resident in the county stays home and practices social distancing, no additional restrictions should be needed. At last night's City Council strategy session, the city discussed providing additional funding to the Men's Shelter of Charlotte and the Salvation Army Center of Hope. The city is considering using federal HUD dollars to support 50 families identified by the Salvation Army and 70 individuals identified by the Men's Shelter. This will create additional capacity of both shelters, allowing the shelters to serve more medically fragile, unsheltered individuals and families. The proposed funding is expected to be presented for approval at the City Council meeting on Monday, April 13th. As you know, you approved an emergency leave policy for county employees. The emergency leave ensures that county employees that are unable to telework will continue to get paid. The 80 hours that was originally granted is about to expire. I will be extending that emergency leave for another 2 weeks to continue continuity of pay for all county employees. My commitment has been and continues to be that all county employees will continue to get paid during the pandemic. In addition, we are aggressively evaluating all the changes at the federal level related to FMLA and pension changes and implementing them accordingly. And with that, I will turn it over to Gibby to provide her update. Thank you.
Good evening, Commissioner Dunlap, Chair Dunlap, Commissioners, and Manager Diorio. I wanted to give you a brief update on where we are with the situation in the county right now. To date, as of 4:30 this afternoon, we've had 805 laboratory confirmed cases in Mecklenburg County. There have been a total of 8 deaths, and those range in the age from 60 to 93, all had underlying health conditions. We've had lots of questions about testing. In our community, we continue to test those who are most at risk, and especially where testing would make us respond differently. And those situations typically include individuals who are ill enough to be hospitalized, as well as our healthcare workers and first responders. We're continuing to ask people if they have mild symptoms to stay at home and consider the fact that they have COVID-19 and self-isolate for the time frame that they need to until their symptoms are gone for at least 3 days. We also ask them to consider those that they may have exposed and work to alert those individuals, since we will not be doing any contact tracing with those cases. You received data yesterday, updates from our data in the community, and I'm just going to speak to a few of those. This is specifically for data as of April 4th. We had 605 cases at that point that were reported in county residents in Mecklenburg County. These only reflect laboratory confirmed cases. We want to remind people that there are many individuals in our community who are infected with COVID-19 who have not been tested because they are asymptomatic or do not meet the current CDC recommendations for testing. So the numbers that you see only reflect a snapshot in our community, do not reflect the true burden of COVID-19 in our community. The other thing I will point out, and I'll continue to point out, is that our numbers may differ from what you will see in the state and federal counts. All of the cases that are tested in Mecklenburg County, regardless of whether they reside in Mecklenburg County, come to us and are reported directly to the state as well. We evaluate those test results as they come in and make sure that we are only reporting Mecklenburg County residents. So the data that you see in the reports that we put out are specifically Mecklenburg County residents. Highlights from the 650 reported cases: about 3 in 4 reported cases were adults between the ages of 20 and 59. We had 11 cases in youth under 20 years old. Younger adults make up most cases for all racial ethnic groups, except non-Hispanic Blacks. I know this has concerned a lot of individuals in our community. What we are seeing is about 1/3 of the cases in non-Hispanic Blacks are in individuals over the age of 60, and only 1/4 were in the youngest age. So it's the complete reverse of what we're seeing in other populations. I want to point out too that more of our deaths disproportionately are found in African American community. They are among elderly with underlying health conditions. At this time, we do not believe the racial ethnic differences observed in our data are related to the spread of COVID-19 or differences in the susceptibility of certain groups to being infected by COVID-19. We do think these differences are more likely related to our current testing criteria, which is focused on symptomatic patients and those with underlying racial ethnic disparities and rates of chronic conditions that increase the severity of illness with COVID-19. I don't know if any of you heard the points that were made by our U.S. Surgeon General today that actually shows that this is playing out across the country. What this does for us is emphasize the need for good access to testing in the county for those who need it, and also making sure that people know when to seek care and testing, regardless of the population. About 1 in 5 cases, reported cases overall, were hospitalized due to their COVID-19 infection. However, the hospitalization rates among older adults, those over the age of 60, were significantly higher, and are 1 in 2 of those individuals were hospitalized. We've had 8 deaths due to COVID-19, as I mentioned earlier. 40% of reported cases have been released from isolation. That means that they have met the CDC criteria and are considered no longer infectious. There were reported cases of COVID-19 throughout our entire community. You can see that on the map that was released yesterday. We are seeing widespread infection and just continued confirmation that we have community spread in Mecklenburg County. We have designed a COVID-19 awareness and social distancing campaign after reviewing the data to make sure that we are providing information specifically to those who are either potentially more impacted by this infection, as well as those who have the potential of spreading it more readily. This includes our younger adults and our non-Hispanic Blacks 60 years and older. We plan to communicate this proactively in a culturally competent manner, and we are currently seeing in the COVID-19 cases. Our marketing efforts will include a combination of paid ads and posts, as well as grassroots efforts within the community. We will target these types of activities to the particular populations. So we're looking at 4 weeks of combined radio ads and social media posts with those 30 social media influencers made up of college students, local radio personalities, and local celebrities. That will create over 300 posts. There will also be at least 400 radio commercials on urban radio, gospel, Spanish, and early market stations with endorsements from radio talent. We're also looking at grassroots marketing campaigns, amplifying the awareness messages, and we've identified potential partners, including many faith groups and others who work directly with the African American over age 60 group. These partners will share printed materials and information. We're working with Novant Health. Dr. Jerome Williams has offered to leverage his team's community engagement outreach to help us with this population. And we recognize the need to deliver accurate, trusted, culturally competent information through the lens of health equity. I want to reemphasize what the manager said about the stay-at-home order. We are seeing some slight evidence that the order is having the desired effect in our community. And I do believe that the continuation of this order is critical to our being able to, number one, reduce the number of cases as well as the deaths, but also to manage what we're seeing in our hospital systems. I left you with a quote the last time I spoke with you, and I'll do that again tonight. If we view ourselves as besieged victims who need to go into hiding, then we will cultivate fear and hoarding. If we view ourselves as a community working hard to protect the most vulnerable among us, then we will cultivate courage and helping. Mindset matters. I really encourage everyone in our community to be part of the solution and to stay at home. Thank you.
Mr. Chairman, that concludes our presentations. As I indicated, we have representatives from the hospital systems here to answer questions. And so myself and Gibby, as well as our hospital representatives, are prepared to answer any questions the board may have at this time.
Okay, so let me tell you how I want to proceed with this, because I know there are a lot of questions, but we won't be at this all night. So I want to give both of the CEOs of the hospital an opportunity to share any comments that they might have. After which, we'll allow each commissioner an opportunity to ask questions up to 7 minutes. And Madam Clerk, please put the timer on 7 minutes. You will get a second opportunity if you need to, no longer than 3 minutes, for a total of 10 minutes. And that's a lot of time. So let me start with, Gene or Mr. Amata, either one.
Sure. Well, thank you, Mr. Chair. Thank you, commissioners, for including us. I guess let me just start by recognizing Dina and Gibby's leadership and how they've partnered with the health systems throughout. From the very beginning, we've been in daily, multiple times, actually, communications, because we've realized the only way to combat this virus that no one has ever dealt with before is by coming together in a unified manner. So I just wanted to start off by saying thank you. I know I speak on behalf of both Carl and I for that. Carl and I also have been committed to working together from the very beginning to leverage our collective capabilities to protect patients and the community, which has been our singular focus. If I step back a little bit, when we saw initially how quickly this virus was spreading, doubling every couple of days, we were, Navant and Atrium worked together to be the first in the state to cancel elective procedures voluntarily at significant financial consequence to each system. But we knew that we needed to move quickly to create more internal capacity and bed space. We also, as you know, co-authored the request for the stay-at-home order. And we just take this opportunity to really thank the commissioners for your very quick actions to protect healthcare workers and the community. We appreciate each of you for that, and you literally have saved lives because of your actions. As Dina said, the good news is that it does appear to be beginning to work. The peak surge that we were anticipating for mid-April looks to have been pushed into May. But that also was shared that it's essential that we continue to adhere to these stay-at-home policies, or we will quickly revert to the exponential curve. It was also mentioned that to supplement our bed capacity, we initially forecasted we would need approximately 3,000 beds to be set up in a field hospital within the past 48 hours. As Dina said, we were advised that we should not anticipate state or federal support to help staff or equip the field hospital. And so we have quickly come together to recalibrate that plan. Both systems immediately have doubled down significantly on efforts to expand capacity even further. So about a month or so ago, we had capacity collectively about 3,000 beds. We've now doubled that. And the combination of the additional internal capacity of the health systems has generated the flattening of the curve due to stay-at-home orders, as was highlighted, and the realization that we should not anticipate right now additional support had us adjust our request to 600 as was stated. And now we're looking at alternative sites, including on our own properties to see what might be available with the help of the Army Corps of Engineers. So we're in the process of finalizing those and hope to have those plans effectuated here in the coming days. And I'll just conclude my remarks by saying that we are recognizing a National Public Health Week, but we also want to add to that the first responders and the healthcare workers. It takes a very special person to work in the healthcare field. It's a calling, and we are extraordinarily proud of our teammates who are answering this call at these times. So with that, I'll conclude my remarks and entertain any questions.
Okay, so at this time, Mr. Amato.
Yeah, thank you, Chairman. And I want to congratulate the county commissioners and the county manager and our director of health for their quick action. And I just want to highlight some data that obviously we're looking at. There's a website, unacast.com, that shows the COVID-19 social distancing scoreboard. And when you look across the United States, the scoreboard shows a C for the decrease in average mobility and the decrease in non-essential visits. Mecklenburg County's grade is one of the highest in North Carolina. It has a B-, which is one of the highest. And I believe it's because of that swift action that you as county commissioners can be proud that we have flattened the curve. And so that's the good news today. I know Gene and I have been diligently, and our teams have been working to make sure that, number one, we're here to protect every resident of Mecklenburg County, protect our team members. As I think about what we've done, we tried to first make sure we had as much protective personal equipment to protect all of our team members. Second, we looked at our facility capabilities, and like Gene said, our ability to expand beyond 50% capacity, not only with med-surg beds, but with ICU, intensive care unit capability, has been really something focused on, and we've crossed that hurdle. You will see that we together now will come up 600 additional beds that we think we can divide up between our campuses and keep, because we have to staff that, we'll have all that right within walking distance for our team members. And then the other thing I want you to know is we've been actively managing to care for all of our members, and the county has been very helpful with regard to daycare and housing for team members that were concerned they might have gotten exposed. A very, very large thank you for helping us with all that. And then, you know, last but not least, right now, I want you to know that when I sit in rooms across the country, you know, I'm really cautiously optimistic about where we are in Mecklenburg County. As I look across the state of North Carolina, as I look at some of our other markets, and as I talk to other healthcare CEOs, and I want you to know the teamwork that Gene and I have put together with our two organizations, we're going to stand up and not only be ready for the surge, we're going to help pull our community out of it so that we can get back to taking care of all people. And when I say all people, I want you to know that we're also aware of the health disparities. We're out there with our now community mobile care to get into zip codes that need testing. We're looking at how we're going to use the Michael Jordan clinics to ensure that we can address what we're seeing in the news, not only in our community, but across the nation, about how we've got to address these healthcare disparities in the zip codes that they're in. So with that, Mr. Chairman, I'll take questions, and I'm completing comments.
Okay, at this time, we'll hear from commissioners up to 7 minutes. This first round, you don't have to use it. We'll start with Commissioner Cotham. Commissioner Cotham, any questions and or comments?
Thank you. I appreciate the presentation, and I do not have any questions at this time.
Okay, thank you. Commissioner Fuller.
All right, thank you, Mr. Chairman, and thank you to our county manager, our public health director, and to Gene Woods at Atrium Health and Carl Amato at Novant Health. Thank you all for the work that you're doing to help us address this unprecedented, historic time in our community's history and our nation's history. Really remarkable work being done in Mecklenburg County. I continue to be proud of our community, of our ability to come together when times are toughest, and that there are many across the country who are watching what we do, and indeed are often led by what actions that we are taking here locally. So I want us to continue to be encouraged to act and act effectively and swiftly. So I do want to talk about a couple of things and just a couple of questions. I think I understand now about the proposed mass care facility and what happened with that. We had heard in the news about the request for a larger facility at the UNC Charlotte campus, and I take it from your comments today that that we've had to revise that plan and instead focus on the 600 bed number. And I take it from what you've said that it may well be more than one location, but in any event, the idea is to get 600 beds somewhere near your respective uptown locations. I am saddened that we will not have any federal or state support to do it. We are blessed in Mecklenburg County that we do have resources to be able to protect our people. And, but I regret that we have to do it alone. But if that's what we have to do, we have to do it.
Commissioner Fuller, can I just I want to make a point of clarification because I wasn't clear in my talking points that what we do locally will be eligible for federal and state reimbursement. But as you know, the supply chain being what it is, we won't be able to obtain supplies and equipment and staffing and other things through that mechanism that others have been able to do. But whatever we do expend here would be eligible for reimbursement. So I just want to make sure that's clear.
All right. Well, that's a good clarification. Thank you for that. I think, nevertheless, it will mean that we will have to dig into our own resources in order to be able to do this. And again, I say that we are blessed that we have the ability to be able to do that. I mean, there are many communities, even in our state, who can't do that, who can't simply rely on reimbursements. So, I'm glad that we have that ability, and I want to encourage us to continue to be looking ahead of where things are going to be, not just looking at what's happening today, but where they're going to happen in the next month. I do want to also ask about the order, the stay-at-home order. And I heard you say there was going to be increased enforcement of the order. Give us some granularity about what that will mean for people who are out and about driving on the streets of our community, who are congregating in Walmarts and grocery stores and crowding our parks. What will it mean that we are going to increase enforcement of our stay-at-home order?
So I did give you one example about the parks. We have been getting a lot of feedback about the crowding in the parks and the greenways. So we think that the actions that we're taking will help reduce the number of people, especially in our larger parks, and we'll be using law enforcement to help facilitate social distancing in the parks. And so we haven't been able to do that before, so we will be able to do that. There is continued ongoing discussion around closing boat ramps. We're getting a lot of feedback about that. That is being done on a more regional basis with everybody that's got shoreline on the lakes. Duke Energy has taken the lead and is trying to evaluate the best way to manage that. And that's something we'd want to do regionally, because if Gaston closes its boat launches, what'll happen is that everybody will just come to Mecklenburg. So we don't want that. So that's part of what we're trying to negotiate and navigate. The other thing that we've talked about is whether or not we should be requiring stores to limit the number of people that are in there at a time. For example, Lowe's, Home Depot, some of the big box retailers on a Saturday are very crowded. And do we need to take some more aggressive efforts to try to work with them to try to minimize the number of people who are in the store at any one time? And we've seen other stores do that. Best Buy, for example, has a limit to the number of people who can go into a store. And so these are some of the things that we're evaluating when we talk about more aggressive enforcement. Those are some of the things that we're thinking about. We don't have any plans at this point to start stopping people in their cars and asking them where they're going. That's not part of the enforcement efforts. But again, just looking at targeted places where we're seeing lots of people and thinking if there's ways that we can try to break up some of those, what we would call larger gatherings.
All right. And speaking of the order, I've received a number of calls. I know others have as well, and emails about which businesses are considered essential businesses. And I understand there have been some clarifications and perhaps amendments to the order. I certainly am sensitive to the concerns of for example, our real estate industry and our automobile dealers. Although I do have a concern about the changing nature of this order happening without much input by elected leaders who are responsible because we've been elected to serve this function. And I understand the needs of an emergency situation. I understand that. But I would call for more collaboration with elected leaders about these things, because ultimately the people expect us to be responsible, and they will ask us about why we have why we've allowed certain things to happen, why we require certain things to happen. And I, for one, I don't like
minutes.
I, for one, don't like having to answer questions about things that I have had no part in creating. So I would like to see some more collaboration with elected leaders about these.
7 minutes is up.
I would like to have more collaboration with elected leaders about these issues, because when I receive calls about them, I don't want to serve as a lawyer for the board to explain what the order means. I want to, and it's appropriate for me to serve as an elected official explaining why things are the way they are. So that would be my ask, that to the extent that we can, understanding the emergent nature of what we're dealing with, see if we can't have more collaboration with elected leaders about these issues.
Okay, Mr. Fuller, well, let me just share with everybody so that we can be fair with everybody. At 7 minutes, I'm going to ask the clerk to mute me so that we can be fair to everybody, because I don't want to get complaints that I allow one person to talk longer than anybody else. Okay, at this time, Commissioner Scarborough.
No comment.
All right, thank you. Commissioner Harden.
Thank you. So I have some kind of yes or no questions. And first I want to say is I just really want to thank the CEOs of Atrium and NoMop for being here. We just really appreciate everything that you're doing for the community, and we recognize how incredibly busy you are, but that you're standing before us and speaking to the people of Mecklenburg County. It means a lot to us. So it means a lot to my constituents. So I appreciate you making time to be here tonight. I want to say, I have some yes or no questions. One, can we get the new curves with the revised projections? You know, we had beautiful curves with 0% social distancing and 30% social distancing with the previous projections. Can we get those revised?
Sure.
Thank you. And if I heard correctly, the total systems, both systems combined, the planned surge capacity for Mecklenburg County without the field hospital is 6,000 beds. Is that correct?
Correct. It's 6,184 beds. This is Carl. And you add the 600, we'll be at 6,784.
Thank you, Mr. Amato. Can you tell me what the individual surge capacity is for each of your systems?
So Novant will have, if you look at what Novant will have, is probably for 1,600 of those beds. And Gene, I think your number was 4,500 plus.
Correct.
Thank you. How many staff will you need for a 600-bed field hospital?
Gene and I estimated 700.
We're finalizing that, but we're thinking, we're finalizing those numbers, and it depends on a number of factors, but about 700 is what we're estimating.
And so if I understand correctly, I share Commissioner Fuller's sadness that we won't be receiving any state or federal support up front. How much do you think this field hospital will cost?
We're not at this point. It really depends on what the final location is. So we're investigating other capacity on both of our properties, but also other possibilities in the community. So that's the work that we will be doing here in the coming days. So we're not at this moment able to give a precise number on that.
When those plans are finalized, can you share that information with the public and commissioners?
Yeah, we'll be sharing that through the meetings that we have with Dina and Gibby when we land on the final plan.
Thank you so much. So this question is for the county manager. Do we have any reason to think that we won't be reimbursed for the cost of the field hospital?
We do not have any reason to believe that we won't be reimbursed for the field hospital. The way that this has been explained to me, the way this will work is actually once we land on a location, the feds will actually build it. So the Army Corps and the state will actually build it. But the part that we would need to finance ourselves, whether it be the hospitals, the county, or some combination, is the supplies, the equipment, the PPE, and the staffing.
Is there any reason to think that in the long run we'll have to finance any of the expenses?
You know, we don't anticipate that, but we can't guarantee it, but we don't anticipate it. That's I've asked that question probably 50 times, and that's how it's been explained to me that these are eligible expenses. FEMA is actually expediting these reviews, making them much quicker than they were before under other circumstances. And so again, that's how it's been explained to me.
So again, I just want to thank it means so much to the community to hear directly from the hospital systems. I hope that the CEOs know how much the public appreciates hearing from them directly, and how much confidence and strength it provides hearing from them directly. It means a lot. And so thank you. We are one community. So thank you for your coordination and your cooperation with each other, because it really means a lot to the community. The last question, the last point I want to make, and then I'll have no more questions at this time, is I agree with Commissioner Fuller's statement that we need. It's important that county commissioners be involved to the extent possible in the development of the policies. And so I would concur with his assessment that he would like to see commissioners more involved in any, in both in the decision to, what's included in the stay-at-home policy and decisions about how that is elongated or added to or enforced. And so I want to raise up and support Commissioner Fuller's request in that regard and say that I second that request. So at this time, I have no further questions.
Okay, Commissioner Jarrell.
Thank you, Mr. Chairman. And, thank you for the presentation that we heard tonight and for our CEOs to be here. As Commissioner Hardin said, it's really important. It's a great signal to the community. And I want to thank everybody for the tremendous amount of work that's going on behalf of the community. I'm going to try to get through quite a few questions here. The first one is, if you go to the state has a dashboard, and this is to Gibby and Dina. The state has a dashboard, and on the dashboard, it breaks down the data around COVID, and it breaks it down by age, ethnicity, gender, cases over time, so on and so forth. And I think the dashboard is really useful. And so I know we've been having data requests. Can you guys take a look at that and see if we can mimic that and have the data in a similar format where it breaks it out, race and gender, and gives a cumulative number and not just the percentages as well, so we can really understand what the impact is in certain communities? And are you familiar with that? First of all, are you familiar with that dashboard? I guess I should have asked that first.
This is Gibby. Yes, I'm familiar with the dashboard, and we can take a look at that and look at the possibility of putting something like that up. We're always careful about numbers to make sure that we balance the need for the community to understand and know what's going on with the protection of individual rights. So we will continue to look at that as we put data out. But yes, we'll be happy to look at that dashboard as a potential option for Mecklenburg County.
Yeah, okay. Thank you for that. I think it would be really, really helpful. I find it useful, and you can compare county information as well. So thank you, Gibby. I want to also, while I have you, Gibby, I know you said we have 805 confirmed cases, but you mentioned earlier that that's not the true burden. Obviously, people are asymptomatic. What do you think the actual number is? I mean, have you guys put anything together around that? Do you have an idea?
Unfortunately, because of the way testing has happened in this country and the way it continues to move, we don't have good surveillance data to help us with that. The only thing we have is a projection from CDC that at one point they thought potentially 25% of a community where there's community spread could be infected. So that would give you some idea of what we might actually be experiencing here in Mecklenburg County.
Mm-hmm. And so I want to stay on that line for just a second. I want to go into modeling and understanding. Obviously, patient confidentiality is important, and so this question is not going to be along those lines. But I want to understand, as we're looking at our residents who have contracted and are testing positive, have we done any modeling? Do we know if there are certain industries that are being impacted? Do we know if are there certain trends that we're seeing among residents who are contracting it? Is it socioeconomic? What are we seeing, or what are we collecting so that we can put out there? So in essence, is there any sort of modeling going on at that level?
We have, to be perfectly honest, with the staff that we have available that are attempting to continue to do contact tracing so that they can notify individuals of potential exposure so they can monitor themselves and protect others from themselves. Our staffs have their hands full. We are trying to look at data that we gather through our investigations, and our EPI folks are looking at that. Currently, I don't have access to that, to be perfectly honest, but we are starting to take a look at that and see how we can break some things down to understand a little bit better what's happening in the community. The only caveat there is all we know is the positives that are being reported. So it still doesn't give us a full picture of the community, unfortunately.
Yeah, I think it would be helpful and useful. I would love to be able to let the community know if certain people are at greater risk due to profession or other factors out there, so that we could really have a full-blown campaign around educating the public. So this question is, go ahead. I'm sorry.
I was going to say, if I had to guess, some of the different groups that are probably more at risk are our first responders and our healthcare workers who are working in this day in and day out. That's where we're seeing higher numbers, to be honest. And at this point, we really haven't seen any clustering of cases in terms of different businesses or types of businesses. I will tell you that we've not seen that at this point.
So you're collecting that data, so that's good to know.
Yes.
Dina, I've got a question for you. I know the surge numbers have been reduced, so we were expecting between mid-April and mid-May a surge of about 3,000. I guess now we've lowered those projections to about 600. How does that affect our stay-at-home order? What are your thoughts around that, and when do you think a decision will be made around, or discussion around, if we're going to extend, or what does that look like?
So I think, as I said in my talking points and talking with the hospital CEOs in Gibby, that curve, that 600 surge number is really based on the stay-at-home order staying in place for some period of time. So we don't know when we would have to have that conversation, but we're certainly going to be aligning with what the governor's thinking. We've heard a little bit that he may want to extend his order, but we'll continue to monitor. I don't have an exact date at this point in time, but it does assume that we stay at home for longer than we are right now.
That's the end of your 7 minutes, Commissioner Jarrell.
Okay, Commissioner Leak.
Let me first say thank you to our board members who are participating today with restraint from without seeing each other and seeing our faces, and that's what I have of value to my cohorts, knowing and seeing what they're saying with their body language. But I do want to say to the hospital personnel that came in to talk with us, thank you. We're hearing the same information across the country every day. So the questions we're asking are some of the same questions that have been out there every night. And this community is important to all of us. And the question I used to ask myself when we would start a meeting is, anybody listening? And does anybody care? And that's a part of my motto to say to my people, and especially to my senior citizens. But when I heard that today was the deadliest day in the history of this country for New York and New Jersey, it grieves me to know that seniors are put upon to carry the burden of this load when it comes to living and having good health, not living in a food desert. to those people who've already been penalized because of economics. And all of those issues grieve me as a member of this community and across this nation and really across this world when you look at it. When I hear that the greater number, and I'm not sure I understand clearly, and I say to those of you who are giving us the information, give it to in a layman's term so all of us can understand what you're saying and the questions that you're asking and the response to those questions. To you, our manager, and to you, Harris, thank you for your laboring in the dark, late at night, in the wee hours of the morning. But we have to do a better job of treating all people right. And that's those who seem to be the least of those are our senior citizens who paid and continue to pay the price for this country and this community. And I wrote down a couple of things here. I looked at the Veterans Hospital that's out here on off of Tybola. Are there beds there that we could use as a part of this process as large as that facility is? Are there old sites that's not being used that happen to be great use for big industries that could be used to help us to provide a safe environment for our people and give us good health? So all I'm saying to us is to stay at home if that's what we're saying, and we know that that's what will eliminate some of the pressures of those who are being helped or non-helped with coming down with this issue of a virus that we've never seen nor heard of. And as I listen to the scriptures today, I want to thank you, son, for lifting that up for me, for my spiritual support, and for those with whom I've communicated these weeks, where the nights were lonely and the days have been long. And we are talking about how can we save our people. And for some of us, we've heard this for the last 40 or 50 years or 60 years. And there has been no relief for some of us in this country. So all I'm saying to us, let's change this process, because it's not picking and choosing people. It's not selecting given individuals. It's all over the world. So again, what can we do to make our community what it ought to be? And that is to stay at home, do what we have to do in calling each other and saying kind things to each other. My questions deal with what are we doing to make life just a little bit easier, again, as I say. On the dashboard, it can be on the floor, it can be anywhere. But make it plain so my people in the zip codes that you talk about are in District 2 and 3. So this is why I grieve so, and talking to one lady who said to me, Leak, I pray that I wake up in the morning. I don't know, I'm 89 years old. I said, you will be up in the morning before I get up, my sister. So those are the kind of burdens some of us carry. And I hope that we will do a better job of providing for the deserts, for the homelessness that we have, for children whose parents have yet to realize their responsibility, and also the education system, which is not educating our children well. So I had to bring all of that to the picture because that's a part of it. That's truly a part of it. So I finished my statement with this: the deadliest day in America for New York and New Jersey. Never thought I'd live to see it. Is anybody listening? And does anybody care? Thank you, Mr. Chairman.
Thank you. Commissioner Susan Rodriguez McDowell.
Thank you, Mr. Chairman. I would like to say thank you to our guests for being with us tonight. I also want to say thank you to my alma mater, which is UNC Charlotte, Chancellor Dubois, they were willing to create a tent city, or not a tent city, but a hospital, a field hospital. And I just think I can imagine all of the work that went into them planning that. And I just want to thank them for being willing to do that and for starting that process. But I was wondering if you guys could speak a little bit more to the change in the beds, the modeling for the surge going down to 600 beds. Is that more on modeling, or is that more on the lack of federal reimbursement, that choice, that decision?
Commissioner, this is Carl Armato with Novant, and I know Gene will want to add some comments, but what we've been doing is updating the model hourly with new data. And so from week to week, what we were inputting is not only the national experience, but we started to look, and not only our state experience, but we started to look at our experience in our own county of Mecklenburg. And so as we started to continuously input new information and new data, what happened is the social distancing factor went up pretty significantly from where we started. And so we actually needed a lot less beds overall. But then what happened was our expanded capacity of both systems. You know, for example, I'll just give you Novant. We started out with 976 beds in market, and now we're going to be over 1,600. So I'm just trying to show you, we went from, yeah, we're going to have a surge, but now it's less overall beds, but we also expanded our capacity to cover what we think the surge projection in beds is going to be. And Gene, you might want to add some comments to that.
Yeah, I would just add that the reality of it is both it's the reforecasting, it's the stay at home, but it's also what we could stand up. We started off with 2,200 beds in this area. We're now north of 4,500, as was said. So we significantly increased our capacity. Part of our challenge, because we draw from more than 11 counties, and patients come to us from all over. What we were also trying to plan for is, as the outlying communities have less resources and have less capabilities, we knew that we would have to accommodate that as well. So part of the thinking in the original also number was realizing that we would have to draw from a broader area. Okay. And so we're now looking at the 600. But we're not going to stop at 600 because, we'll continue to look. These models that you've seen nationally and local, they're a bit volatile. We've talked about that they're more like predicting hurricane paths with probability. So we're gonna lift up 600. We'll continue to look at more capability. And part of our calculus is also just recognizing we're a big regional referral center, and we're having to think about how we accommodate additional patients as other communities struggle.
Okay, thank you very much for that. That really helps color in why the 3,000 number was there. Now, having said that, I do feel that I have a little hesitation. I just have to tell you that looking at our current hospital systems, and the facilities that they currently have, and just the corporate executive paychecks and salaries and those kinds of things, I have a real problem with taxpayers paying into this system. So I really want to understand, first of all, how much we're being asked to contribute as far as the supplies, the equipment, and the PPE. I understand that these are needed, and I would never want to not have those supplies, but I'm just questioning where those funds are coming from. What are patients going to be billed? And then they're also going to be reimbursed by the government. Like, I really want to understand how this is all going to be paid for. And I really want to make sure that Mecklenburg County taxpayers are not paying for things that our very well funded medical delivery system can pay on its own. So I hope you understand where my question is coming from, that our medical system, the way it is currently, is a for-profit business. And so if this is a timing issue on funds and the county's being asked to bring funds to the table, then that's one way of understanding it. I really need to have a little bit more around that. And I don't know if we're not having a vote tonight on this until we have more information from the county manager. Is that correct?
Right. We're not requesting an appropriation of funds at this point, and we have not been asked to fund anything at this point. Once we get a better sense on how the process is going to work, really our emergency management folks at the local level is really going to be responsible for helping to source the equipment and the supplies that are going to be needed. And the hospitals do have a mechanism to get reimbursed themselves for whatever expenditures that they make. So at this point, there's no ask of the county for any financial support. We'll continue to keep you updated as we move forward, but that's where we are today. In terms of
the letter said that they were looking for funding from the county, the letter from April 2nd. That's not what
they were asking for support, but there's been no commitment on behalf. I certainly haven't committed on any financial support.
Oh, great. Okay. Well, thank you very much. That helps me understand.
This is Gene Woods. I would just like to add a couple things. One is that, working with other health systems across the state of North Carolina, the collective health systems are having to step up into also a public health perspective, and collectively, the hit, at least as of recent numbers, to healthcare systems is going to be in the state is going to be north of $3 billion. And so I do think that I would suggest that the health systems are stepping up significantly to support the community, working in partnership. But also, we would want the commissioner to appreciate that even stepping up 50% additional capacity that we've done in 30 days, which not many in the country have been able to do that. And even after we canceled elective procedures, we're at multi-million-dollar hits in terms of our ability to continue to purchase supplies and things of that nature. We are still working actively to figure out how we could get PPEs, ventilators, and personnel. So even though we've got the space, we're working every single day to get that, and we'll need continued support from. We're asking of the state, we're asking of FEMA. So even though initially we said that there's going to be nothing available, that has to stop us from also sourcing international supplies and other commercial supplies. So I just wanted to just make the point that the health systems are stepping up. Our healthcare workers that are putting their lives in jeopardy every single day are stepping up, and we're also helping to augment in these times, because we're being called into action, really serve as much as anything, supplement the public health needs in the communities that we serve.
Okay.
The other point, this is Carl, just to highlight, we really were looking for, and we've gotten it from both Dina and Gibby, but it's been their help in helping us navigate emergency management and dealing with some state issues that trying to set up, such a field hospital. So they've been very helpful in that. So that's really where a lot of the support needed in their giving.
Okay, Commissioner McDowell, your time has expired. Commissioner Powell.
Good evening. My first question is for the executives at Novant and Atrium. And I do want to get to what Commissioner Rodriguez-McDowell was talking about, but I first want to ask about, can you talk to us about the increased ability to test in Mecklenburg County? We're saying people with symptoms to come in, but it seems like it would be, if we could be proactive and especially start testing in high risk, high poverty populations, specifically homeless people or those living in cars, and people who are hypertensive and have lung ailments. Do you ability to increase testing?
Yeah, this is Carl from Novant. Actually, finally getting to a point which is very positive, where at one time we had 54% of our testing was pending. And so far, year to date, we've done about 10,200 patient tests. And at one point, working with companies like LabCorp and others, we had about a 55% pending result rate. And it was pretty significant. So we're finally down to roughly about a 4% pending. And we also have been able to work out and have a couple of our own in-house testing capabilities. So I think pretty soon, as we continue to grab and acquire more test kits and the capability, we should be able to do more testing and target, the zip codes that you're referencing and the high-risk populations that we need to focus on. And I know our physicians are on the call and they could add feedback to that, but Gene and I both now have in-house capability to increase our testing.
Dr. Hunter, do you want to add to that?
Sure. So this is Dr. Hunter with Atrium. So we are following all the current guidelines. We're actually more expansive than that. There still continues to be a shortage of reagents, swabs, some of the things that you actually need to run the test. And so that is one of the things that's preventing us from being even more expansive than what the CDC is asking. We have one of the only states in the labs in the state that allows us same-day turnaround. And so we as a community have lots of advantages, and yet we are still hampered somewhat by access to the reagents, to the viral transport media, those sorts of things. But we have been working with Novant and with the community, and so would aspire to what you suggest, and we'll get there as soon as the resources that we can access allow us.
I really appreciate that, and I think like you have the support of me, and I'm sure the county commission on how can we test more, and also are we ready to expand if people in the community are scared. They're hurting and they're scared, and they want to know that we will be able to take care of them if we need to. And so I really appreciate all of the work that you guys have done to expand your bed capacity. And my understanding is that right now you can manage what is happening, but that the capacity is time sensitive. And there's uncertainty even with projections about what we might need. And so if we do need UNCC eventually, is that something that we're keeping, open? And you said you're looking for other sites, that's alternative sites, that's good. But I think it's important for the community to know, because we're getting telephone calls and things about, can I come down from New York? Can I come from another area where they're scared that they're not going to get care? And so people are fleeing, and they think Charlotte would be a good place to come. And we're also hearing about the broken healthcare system in North Carolina, where many rural counties don't have what they need. And so I think, we're going to end up serving more than 11 counties worth of people who might need help. Can you speak to increased capacity and just being ready for that?
Yeah, this is Gene Woods. We as you said, we're looking to lift up these 600 beds, but we won't stop. And we know people are hurting. The comment also, we're committed to reaching into the most vulnerable communities. And we not only believe that we're going to do that now, but as we come out of this, we know more people are going to be hurting. So you can count on us to work continuously with Dina, Gibby, and all the other community businesses and stakeholders, that as we come out of this, we're going to devote as much energy to the fight of helping people recover, because I think we're in this for the long haul. And so every single day we're learning something new, we're having to do something new. But I think we have to appreciate the fact that we're in this for the long haul, and we're going to continue, to your point, look at as many resources that we can draw from wherever we can to make sure that the citizens of Mecklenburg are safe.
Yeah, and
thank you.
This is Carl. I just want to highlight too that, we're looking at the two systems. If you look at all of our resources, even outside of Mecklenburg County, if you look at the projections of the models that we have, we're actually seeing that maybe some parts of our markets outside of Mecklenburg may peak later. So we're also looking at, right now we're talking about patients coming into Mecklenburg. We might start talking about and planning for, which is what we're doing now, is how we might be able to move patients to other facilities, other locations, other ICU, intensive care unit capabilities, how we work with the rural facilities, with the telemedicine coverage that we have so they can maybe keep patients at home. So just know we're looking at all of those options in addition to our expansion in Mecklenburg.
Thank you. And I really appreciate you being here to answer these questions because the public wants to hear. And so, I second everybody's request for releasing.
Commissioner Powell, your time is up.
Thank you.
Okay, I think it's my time. First of all, a few comments. I would be remiss if I didn't thank our county manager and Gibby and our emergency manager for all the work that you guys are doing day and night on the weekend. Thank you, Jean and Carl, and for your chief medical officers who are there as well, and to our healthcare providers, our medic, our police, our fire, our nurses, all of those people on the front line. It does my heart good to know that there are people who really do care about this community. And I wanted to make sure that you understood that we appreciate the valuable service that you provide to our community. Just a few questions. One of the things that concerns me as I hear these anecdotal stories is one person is infected, they go to the hospital, they come home to someone else who's infected. How do we know, other than just the time, the 2 weeks or whatever it is, that a person is no longer affected? And how do we know that they won't be reinfected if they come home to a person who was also infected?
Sid, why don't you take that? Dr. Fletcher?
Yeah, Chair Dunlap, this is Dr. Fletcher. Thanks for your question. I think we follow CDC guidance around that. So there's very specific guidance that has looked at infectivity of patients across the world and certainly within the U.S. And so with that guidance, it is 7 days or 72 hours after symptoms are gone, whichever is longer. We do believe that people who are infected with this virus, obviously if they have been infected to the degree that they have developed antibodies and have been, tested positive, et cetera, and then have left a healthcare facility, that they, with the current state of the virus, it has not mutated to a different virus, so they should not be able to be infected by someone else who's at home with the same strain of the virus that we know is COVID, that causes COVID-19.
Okay, thank you. Another question I have relates to this number of African Americans who are victims of the virus versus other populations. And so when I listen to the national news, that really startles me. But when I look at what's happening locally, we find that more African Americans are being tested. I'd like to hear you guys talk a little bit about what helps you to determine who should come in and be tested. I know, for example, that risk, such as diabetes, heart disease, and things like that, those people are more likely to come in and be tested than other groups. And I know that those are some of the 5 primary diseases that African Americans have, which would suggest why so many of them come in and be tested. But could you talk more about how you determine who actually comes in versus those who you believe might have the virus and are just simply asked to stay at home and be quarantined?
Yeah, so this is Dr. Hunter with Atrium, and Commissioner, I think that you've actually tied it together perfectly well. We talked about some of the limitations of resources to test everyone that we might want to, and then given the CDC criteria, the people who get tested are those with certain symptoms and some of those comorbid conditions that are more prevalent, in certain populations. And you put those two things together as you did, that explains the increased testing because they meet the criteria. Underneath that is still what we continue to work on both during pandemics and not, which is what can we do to make it so that those comorbid conditions are not, a disparity into different populations. That's a whole separate line of work. But where we are now, knowing that it is, that explains why the testing is more prevalent.
Okay, thank you. Just two final comments. I get concerned when commissioners want to be involved in making decisions about who is essential and who's not. One of the reasons why the process was set up the way it was so that we're not political. We're not doing favors for one group that we're not doing for other groups. And I can tell you that I have lots of friends whose businesses are closed as a result of this pandemic. And what I don't want to do is feel like because one person might be connected to somebody else, then they can get involved and have their business determined to be essential when another business is not. So that is not to say that commissioners should not be involved, but I would caution against being political in that process, because I read an email that really disturbed me where some people from South Charlotte sent it to a city council member from South Charlotte, suggesting that you understand, but everybody else doesn't. And I get real concerned about that. And the other comment that I will make is that as I listen to the national news, one word of caution that is given to everybody is that we should be careful not to end the stay-at-home too soon. The fear that it may not be where we think it is, because as you say, there are some symptomatic, some asymptomatic, you don't know who's carrying and who's not. And so we end this, and then there's still people out there. So I want us to be very careful. While we don't want people to suffer any longer than they are, but we also don't want to make the mistake of reinfecting this community, which would be far worse than some of the things that are being proposed. Those are my comments. Okay, so if there's a need for a second round, up to 3 minutes, Madam Clerk. If you don't have anything to say, just simply say pass. We'll start with Commissioner Cotham.
Pass, thank you.
Thank you. Commissioner Fuller.
All right, thanks. Just based on what you just said, Mr. Chairman, I agree with you about the concern about political influence.
Oh, Lord.
But some might say that political influence resulted in amendments to the order that have already been made. And so that's why I'm concerned about it and why I raised it as an issue. Because there were amendments that were made based on, for two particular industries that weren't for others. And so I just think that we have to be very careful about that. The second thing I want to raise is,
oh God,
I've heard a lot, excuse me, I'm speaking. The second thing I want to raise is that I've heard from a lot of employees of essential businesses who say that they're being asked to come into work and are not receiving, they believe, sufficient protection, or that their employer is asking them to work under conditions that they believe are risky for them. Have you heard those concerns, and what are we doing about that situation for employees who are compelled to go to work because they're in essential businesses, but feel like they're being exposed at a greater rate because of their employers not enforcing social distancing, not giving protective gear and that kind of thing.
So I can speak a little bit to that, and then I'm sure Gibby can provide some more information. We do ask people to submit complaints like that through CMPD, and we get quite a number of those. And there's guidance that employers are supposed to be following if they're an essential business and the protection they're supposed to be providing their employees. And if that is not happening, then we certainly will follow up on that. But what we have found, a lot of the complaints that we get in that nature are more about people not really understanding what the CDC guidance is, and that they're not necessarily need that. Maybe they may think they need that, but the guidance says something different. And Gibby, you might want to add more to that.
I think, we have gotten a number of concerns and complaints through several of the different hotlines that we have from employees who feel like they're not being protected. And I agree with the manager. Typically what we find is expectations at a higher level than what we're dealing with from CDC. But the other thing we are doing is following up with employers, especially if we get multiple complaints, make sure that they are complying, that they understand what the guidance is. And if those complaints continue, they do go through 311 to CMPD for follow-up with the particular employers. So there is a process in place, and we're trying to make sure that people are getting the protection that they need.
Okay, thank you, Commissioner Fuller. Commissioner Harden.
Thank you. I do have additional questions. My first question is, how many Mecklenburg County employees have tested positive for COVID-19?
This is Gibby. We're not reporting a specific number that have been tested and have become positive that are county employees. What we do is when someone tests positive, that's reported to our communicable disease staff, and they interview each individual who tests positive, unless, of course, they're in a hospital on a ventilator, and then we try to talk with their family. That helps us understand who has potentially been exposed to that individual. What we don't know these days is where people have been exposed. And we do have individuals who are testing positive, who have not exposed anybody at work, but may have exposed folks in the community. So we do our best to make sure that those who have been exposed are given the information that they need to protect themselves and to protect others. But we are not specifically reporting every individual that may test positive that happens to work for the county to the county if there's no need for follow up with individuals who may have been exposed.
You don't think that we need to know that as commissioners, how many employees we have who are COVID positive?
No, I don't. I'm not sure what that benefits. If you would like to share with me what that is, I'd be happy to listen.
Well, I think, I want to make sure that we as an employer are certainly, I think make sure that we as an employer are doing everything that we can to make sure that we're following the CDC guidance on masks and gloves, for example. So in addition to hearing grievances from other employers, we also hear grievances from Mecklenburg County employees. And so, I'm just asking, let me rephrase my question then. Are we following as an employer CDC guidance on masks and gloves whenever our employees go out in public?
We are absolutely. There are several things that have taken place, and the manager has made sure that we have what we need in place through our HR system that protects our employees, that they have the ability to get the protection they need to share the concerns that they have. In addition to that, we have been very careful through public health to create specific guidance based on CDC recommendations and guidance, and have put that information out. Our medical director has done a number of video chats with staff, especially within Health and Human Services, because that's a lot of the staff that's still seeing the community. So there have been any number of efforts, I believe, through the county to make sure that staff are protected, that they receive the resources they need to protect themselves based on CDC guidance, and continue to answer their questions and make sure that they have information as this continues to evolve, which unfortunately it is continuing to evolve.
And let me just add to that as well. Now, our procurement team is on a daily basis sourcing that protective equipment that our employees need that will make us sure that we're in compliance with CDC guidance. You know, we continue to struggle like everybody else does to be able to source what we need, but they are working on it every single day to make sure that the supplies that our employees need, we have available for them.
All right, thank you, Commissioner Harden. Commissioner Jarrell.
Thank you, Mr. Chair. I got three quick points that I'd like to cover. The first is, as a commissioner, I'm going to continue to lift up the concerns that are being raised in the African-American community, particularly about the impact that we're seeing and that this is having in the community, because we know historically that Black people have been underserved in a lot of areas, and one of the primary areas have been in healthcare. And so I think that it is certainly reasonable for people to have a mistrust and concern about what they're seeing. And I want to make sure that we continue to raise that, we continue to bring it up to the powers that be, so that it is properly addressed and continues to be addressed and continues to be in the forefront. Next, you know, in light of that, I also want to make sure that we're forward thinking and understand that as we're going through this, that we've got to make sure that we put the structural components and mechanisms in place that ensure that people don't fall farther behind. So there's a saying in the Black community: when the country catches a cold, Black people catch pneumonia. And the bottom line is we've got to make sure that Black people already in our community are so far behind the majority that when we come through this, we've got to make sure people are stood up, and as opposed to being 50 yards back, are not 100 yards back when we come through this. And so I wanted to stress those points. And finally, Mr. Chairman, I wanted to say and end on a positive and thank the community and everybody who's listening to us tonight. I really want to stress to the community that I've seen us come together in ways that I might not have thought possible at one point in time, but people have stepped up. Nonprofits, individuals, faith communities, our leaders have stepped up and are really trying to lead this effort in every sector. And I am so appreciative. I'm grateful. I'm humbled and I'm inspired, and we've got to continue to stick together and make sure that we come through this together and make a better community than where we were when we started. So thank you, Mr. Chair.
Okay, thank you. Commissioner Leak. Commissioner Leak. Commissioner Powell.
Are you listening? George?
Okay, I hear you.
Okay, thank you. Let me say this. I did tell what the young man has just stated. The thing that hit me this morning was looking at the men who pick up the trash in our community, needing masks and gloves, and they work for the city. So I'm wondering if there's some way we can let the city know that they need to provide resources for their staff to do the kinds of job they need to do. I saw this was public information. And the other piece I wanted to say that the buses are full and people are close together on those buses, and we cannot stop the buses from running because we need transportation. It's like the young man said, we have pneumonia and other people just have a cough. So I wonder if we could address that. Dina, is there some way you can address that? Our sanitation workers.
Yeah, I'll have a conversation with the city manager. Gibby and I can do that to make sure that, you know, they understand what the CDC guidance is in terms of protective equipment for sanitation workers. So we'll definitely have that conversation.
Let me ask you this. The Veterans Hospital that's almost empty out there, nobody's there at night. Is there any way we could utilize any of those beds?
So we can certainly pass that. We can pass that on to emergency management. The Army Corps of Engineers is actually the entity that evaluates those facilities and tells us whether or not they would be acceptable for a mass care site. And so we give them lists of facilities that they go look at, and we can certainly add that one to the list and have them take a look at that. With regard to transit, that's another one that we can talk to the city about. We have had several conversations with our healthcare partners around the need to keep transit and that moving, because a lot of their workers rely on that to be able to get to work. So we want to make sure that we don't make any decisions that are going to impact that. Unfortunately, the flip side of that is sometimes the transit, the buses and the light rail are crowded. And so we can certainly have a conversation with the city manager about strategies potentially that we can put in place to help mitigate some of the gathering in that situation.
But not to remove them from being able to get to their jobs, that those that can get to jobs.
Absolutely, agree 100%.
That was said that they were going to stop the buses from running. And my last statement again is anybody listening? Does anybody care? And I've never seen it this way before in the history of this world. So I thank everybody, and I want to thank the commissioners for being sensitive to the needs of our people. And sometimes when you talk about Black people, people get upset, but that's a fact. I've lived it and I can attest to it. So thank you.
Thank you. Commissioner Scarborough. Commissioner Scarborough.
Anything to add at this point, but I do appreciate this conversation, because I think it meant a lot to a whole lot of us, and I didn't even know some of us were thinking that way. So thank you so much for the opportunity.
Okay, thank you, Commissioner Scarborough. Commissioner Susan Rodriguez McDowell.
Thank you, Mr. Chairman. I just do have a couple of more points I wanted to make. I wanted to say thank you again to our hospital partners. I appreciate that they're here, and I heard you guys say, and I really appreciate that we may be serving the regional community, and I do think that's important to point out, especially in light of how our rural hospitals have been decimated under our current system. So I do appreciate that, and I think it's very important that the community is aware that that might be the role that we would be playing. But I also do want to point out that part of the reason why I believe you guys have been able to match the resources that are needed as far as expansion is because you do have plenty of resources to create massive expansion. That is due to the way our current system is set up. And so I just want to say that I hope that the frontline workers who are putting their lives on the line are getting hazard pay. And I really hope that that they're being made whole for all of this, and that you guys are going to be putting emphasis not just on thanking them, but on rewarding them. That's the main thing I wanted to bring up. I'm getting bugs back there.
Can we have somebody mute their phones, please?
Can you mute all phones other than the speaker?
But this, the last thing I wanted to say is that, you know, it really is times like this that I think we have to be very vigilant and careful about the taxpayers' money, because this is an emergency. This is a disaster. And I think sometimes, you know, maybe things aren't watched as closely because we think, well, we're just in a disaster and we have to react. But I hope that I trust that we are going to be very mindful of our resources, because they're not unlimited. And so we have to be very mindful of that. So thank you very much for allowing me to make those additional comments.
Okay, thank you. Commissioner Powell.
Hi, this is Commissioner Powell, and I just want to talk about what Gibby was saying about mindset matters. And I think we still have two doctors on the line. I would like the doctors to speak to mindset in this time where everybody most every person I talk to has significant anxiety. And so if you could speak to that, and if you could also speak to maybe what some people can do if they're not feeling well, because I'm hearing some people recommend moving your torso and breathing in deeply and doing things like that. So could the doctors speak to that?
Sure. So this is Dr. Hunter with Atrium. So a couple thoughts, and I think you're right on. So the coronavirus infects the body, but it also infects others with fear and anxiety who don't have that, the family members, the community. And we're seeing that in lots of ways. We have invested a great deal in behavioral health, and it is times like this that people with behavioral health issues, you know, this exacerbates it. And so we have 2 hospitals dealing specifically with that. We have all sorts of other telepsychiatry that is also addressing that. But everyday people are infected with fear and anxiety too. And I think it is the confidence that you as commissioners bring, we as 2 very, very competent healthcare systems, the collaboration that we're communicating, it should build confidence in our community to decrease some of that fear and anxiety. That is a very important thing to address as well.
Yeah, this is Dr. Fletcher from Novant Health, and you know we totally agree with mindset mattering, and I think certainly, you know, when you think about your health, it's the mind, body, spirit connection, and so certainly, you know, your mindset is important to your individual health. It's also important to the community health. Jim mentioned some of the downstream around behavioral health. I think we're certainly prepared for steps that may happen both during and after this illness is in our community, so we're aware of that. We also have concerns about those individuals and really a pent-up demand for those that are ill. And you talked about earlier, people were talking about those that are most vulnerable and those with underlying health conditions. And we know that they have been self-selecting to really not receive some of the health care that they may need. So not only are we preparing for those with behavioral health issues, but we're preparing for those that have chronic health conditions that may have been putting that off to just make sure that we're ready for that when we come on the other side of this peak. Thank you.
Commissioner, this is Carl Armato, and I wanted you to hear too. We're also really investing, and we have been for time resiliency programs for our physicians, nurses, and team members at Novant Health. And I want you to know that we've doubled down on that to provide more resiliency now than ever. So those opportunities for our team members and those on the front line to access resiliency programs and opportunities from physicians are made available to everyone.
So I want to thank you, because I think that just you being I just want to thank them. I think that you help the mindset of Mecklenburg County. So thank you for being here.
Okay, thank you. Just a few things. First of all, thank you, Mark, for raising your concern. I want to remind our community that there are a few things that we are currently doing to lift up aspects of our community that may not be faring as well as others. First of all, we have some hotels for those who are homeless and who might be experiencing the virus so that they can be sheltered in place. Tonight, I hope we're going to pass some support for our small businesses. Also tonight, I hope we're going to pass some support for our micro businesses. The COVID fund, which I now understand has about $16 million that's available to the community. Those people who were going to be losing food stamps or having them reduced are now getting more food stamps. And also the fact that those people who have underlying health conditions are some of the first ones who are being tested. So thank you, Mark, for speaking up for that. But those are some of the things that we're doing for those people in our community. The other thing is, I think this is a good time to remind everybody that if you have businesses that think that they should be essential and are not, or businesses that people think are not essential and they are, there's a hotline that we can have them call rather than try to answer those questions ourselves. 704-432-4187, 704-432-4187. And that's where you take those concerns. And then the last thing, I talked to Elaine about this earlier today. As we talk about being more restrictive, I hope this comment about what happens with your physical and mental health, it says to us that what we ought to do is looking for compliance for the things that we already have in place, because the more restrictive we become, the more it affects people's psyche. And so if we can just get compliance from the stay-at-home order and from social distancing and washing your hands, I think we're going to be in a much better place. And I hope the community understands that if we put these things in place, it might increase the likelihood that we'll come out of this thing a lot sooner than anticipated. So thank you all for your comments and your discussion relative to that.
Mr. Chair?
Yes,
Mr. Chair, and I hope, this is Gene Woods from Atrium, and I'm sorry for interrupting.
Yes.
But before you wrap up, we do want to use this forum also, to, obviously, to thank you, but we really want to thank the community. The support that we've had in the past month has been heartfelt, overwhelming. We're getting people making pizzas, delivering food to our healthcare workers. We've got sewing circles going throughout the community. We've got prayer circles going out through the community. We've got people putting signs on our property saying thank you for what you do. We've got people saying thank you for your service. A lot of times that's reserved for folks that have served, the brave women and men that serve the military. They're saying that to our healthcare workers. So we didn't want to leave tonight without saying the community and the business community, every single day we're getting a call from a local CEO saying, hey, we have extra masks, we have extra gloves that we were going to use for our own employees or that we were going to sell, but we're just going to give them to you. And we have a long list of thank yous for the business community, long list of thank yous for the churches and everybody that's just trying to do a little bit so that we all can come out of this together, because it's going to take all of us working together. So we just didn't want to let the moment pass without using this forum to say thank you to the entire community for working together with us.
Well,
absolutely, Gene. Thank you for doing that, because I got to tell you, every little bit of offering and contribution and goodness and thoughtfulness is actually adding up tremendously for the team members that are on the front line every day. So thank the entire community for that all that they're doing to support us, to help us, and to just be there for us as we take it on.
Again, thank you both for your presence here tonight and for your work in our community to help make it a better and a safer place. Thank you so much.
Yeah, and I'd also like to take this opportunity to thank Carl and Jean, as well as Drs. Fletcher and Hunter, for taking the time to be here tonight. We really appreciate all the work that you're doing and the partnership that we've had over these last several weeks. So thank you very much.
Okay.
Thank you, Dina.
At this time, we're going to turn it over to our county manager again to continue her report and give us an opportunity to do something for some of those people that we're concerned about in our community.
Thank you, Mr. Chairman. The next item on my manager's report is the Small Business Emergency Stabilization Loan Fund. And Peter Zeiler is on the call, and he is going to take you through our proposal, and we will be looking for board action tonight to approve that so we can get started. So with that, I'll turn it over to
Good evening, Chairman. Good evening, Commissioners. Good evening, Manager Diorio. Thank you so much for this opportunity. I think this is a great, I think this could be a great tool for mitigating a number of the concerns that have been brought up this evening. We started working and thinking through this process about 2.5, 3 weeks ago when it became clear that the impact of COVID was going to hit our small businesses pretty hard. If we can go to the next slide, please. I think this quote from the Charlotte Observer that COVID is just devastating for Charlotte small businesses fight is absolutely spot on. Mecklenburg County is home to nearly 29,000 small businesses with 50 employees or less. They're being significantly impacted by forced temporary closures by our orders, as well as loss of revenue and customers as folks stay home. Initial unemployment claims in North Carolina between March 16th and March 28th totaled 285,000 compared to the average of 3,500 per week in 2019. It's not just the big companies that are getting hit, it's the smaller companies. We know this because our office is experiencing a dramatic increase in the number of calls for assistance from small business owners. Our phone call count is probably triple what we normally get for folks coming in asking for assistance. It's clear these challenges are immediate, widespread, and they threaten the ability of many of our small businesses to continue operations. Next slide, please. The federal response has really been focused around a Small Business Administration Economic Injury Disaster Loan. This allows folks to borrow up to $2 million. Unfortunately, it requires up to 10 additional forms to be submitted after an initial application submission. While there has been some very recent attempts to speed up this processing, it is clear that most folks are going to have to wait 3 to 4 months to receive funding. There are completed and filed tax forms and schedules that are required. The interest rates are varying depending on an existing relationship with the Small Business Administration. This bullet may be amended shortly, but the loan amount has been determined only after insurance reimbursement amounts were confirmed, meaning that you had to go and understand what your insurance company would actually reimburse you for before you could even apply for an SBA loan. They have recently added a temporary bridge loan of $10,000, but it counts against your overall loan amount. So if you're looking to borrow $100,000, you can actually take a $10,000 advance off of that. Next slide, please. The philanthropic response at the state level has been led by the Golden Leaf Foundation, which, as you may recall, is part of the tobacco settlement dollars. They created the NC COVID-19 Rapid Recovery Loan that launched on March 24th with $15 million in capacity. And by March 29th, it was completely sold out. You can see the little box there that says, "Thank you for your interest. We've received application in excess of our current funding." This was loaning up to $50,000 based on the business's current revenue, loans capped at 2 months of current revenue, 6 months of no interest, no payments, no prepayment penalties, and defaulted loans are subject to collections. I think it's important to know that that $15 million was for all 100 counties. We had one town in Mecklenburg County alone that had over 16 applicants within the first 24 hours for that particular loan product. But again, that loan product is tapped out, and we do not know if and when that funding will be renewed. Next slide, please. Given all this, Mecklenburg County has developed a response, which we're calling the COVID-19 Small Business Emergency Stabilization Loan. This is a rapid deployment of capital to meet immediate needs of small businesses with a simplified application and funds available within 10 days of a completed application submission. The funds can be used for lease or real estate loans, operating capital, payroll, immediate payables, utilities, and the such. This really is designed to be a bridge that allows folks to survive and keep operating their business for the next 2 to 4 months while they're going through the process of the SBA loan programs and any other federal or state philanthropic products that may come out. This is not designed to be a long-term solution, but it is and the name implies, a stabilization fund to keep folks and keep their businesses operating until some of the larger and broader loan products can be made available. Next slide, please. Eligible borrowers would include businesses or principals located in Mecklenburg County, existing businesses with a minimum of 2 years in profitable operation or a growth trajectory documented by tax returns and profit and loss statements. Businesses would be up to 50 full-time employees. They can need to demonstrate that financial obligations and operating expenses could have been met absent the economic impact of COVID-19. We still have our small business loan fund available for startups and companies of less than 2 years age who are not eligible for this program. So if someone is thinking about starting a new business that would respond specifically to COVID-19 as they see a business opportunity, the small business loan fund would still be available to them. Next slide, please. The loan amount is up to $35,000 with a minimum of $10,000. This is based on a little bit of research and effort. We do know that the Golden Leaf loan product, the average loan there was about $34,000. So we think that this is kind of hitting the sweet spot on where we can provide the most funding that is useful funding. The loan would be up to 10 years at an interest rate of 3%. Recall that under state constitution, we cannot give a 0% interest loan. We are required by state statute to charge a fair market rate on any interest rate on loans that we put out. Prepayment is 12 months of interest-only payments, followed by 9 years of principal and interest. There are no prepayment penalties, and if the borrower makes any one payment exceeding 20% of the outstanding balance, we will re-amortize the loan. Collateral is a general uniform commercial code filing on business assets. So we're not saying, tell us the specific item or specific asset that you have that we will place a lien on, but we will place a general lien that if it becomes necessary to go into collection, we can then begin looking at the equipment that is available or the assets that are available to us. All owners with a 20% or more ownership in the business will be required to give a personal guarantee. Next slide, please. This is, again, a rapid access to bridge funds until long-term recovery funds can be accessed. I think a key portion of this is at the back end, we are going to be providing through a vendor some technical assistance for the loan recipients. So it's not just get the money and then you're off on your own. We will be providing back-end support for those borrowers. The long-term amortization and low interest rates result in low monthly payments. You'll see across the bottom there, if you are borrowing $25,000, your interest-only payments for 12 months will be $63 a month. We have found as a national best practice that giving a 6 to 10 month no payment window significantly increases the number of defaulted loans. So even having a nominal payment of $63 to $88 a month really helps remind business owners. This was kind of a, we discussed this at great length, but we really feel that this is a way to remind folks that this is a loan and that it is not a grant, while still keeping the payments at a manageable level during their crisis. Next slide, please. The program funding is proposed to be $5 million from the FY 2020 fund balance for the lending portion. It will provide at least 142 loans if all of them are at the program maximum. If we see that the average loan is actually closer to 25,000, we'll be over 200 loans. We are proposing reallocating $500,000 from the Office of Economic Development Business Investment Program grant to cover the third-party lender costs for administrative and marketing. And then we're also looking to dedicate another $500,000 from the same source for the ongoing technical assistance and support to the loan recipients. Next slide, please. The third-party administrator is the Carolina Small Business Development Fund. You may recall that they are the current loan administrator for our Small Business Loan Fund. They have the ability to quickly mobilize with us on a contract similar to our existing contract. They do have a significant amount of previous experience in emergency funding programs with the Golden Leaf Foundation, especially post-Hurricane Florence. They have applications and underwriting systems available for immediate implementation. Within 24 to 36 hours of adopting this action, if you choose to do so, they will be able to have paper applications available for folks to fill out. And by the end of this week, they'll have an online system where people can go in and fill in automatically online. They're also committing that within 10 days from completed application, qualified borrowers will have funding in hand. Next slide, please. There is a simplified application process. It's one page. It also asks for a statement describing how the COVID-19 pandemic has adversely impacted the driver's license, impacted the business, and then some simple copies of documents such as driver's license, lease agreements, or mortgage statements, a tax return for 2018, a profit and loss statement for 2019, and year-to-date profit and loss statements, including a balance sheet and 1 year of income and expense projection, including cash flow. So these are all typical auditing documents and typical bookkeeping documents that a small business should be able to readily access. And I think we have one more slide. Nope, that is the end of the presentation. Thank you.
Okay, in order for us to move forward, what I'd like to do is read the motion first, see if we get someone to make the motion in second, and then any discussion would follow that. So this time the chair would entertain a motion, and I'm sorry, this is a three-part motion. The chair would entertain a motion to adopt a resolution authorizing the county manager to negotiate and execute a contract with Carolina Small Business Development Fund to administer a COVID-19 Small Business Emergency Stabilization Loan Fund. B, adopt a resolution to establish a COVID-19 Small Business Emergency Stabilization Loan Fund. C, amend the 2019-2020 annual budget ordinance to appropriate $5 million of general fund balance to transfer and appropriate to the COVID-19 Small Business Emergency Stabilization Loan Fund. And D, amend the 2019-2020 annual budget ordinance to transfer up to $1 million for the general fund to the COVID-19 Small Business Emergency Stabilization Fund from available funds in the Economic Development Office budget. Is there such a motion?
So move, Mr. Chairman, Commissioner Leak.
Is there a second?
Commissioner Jarrell, I second.
Okay, it has been moved by Commissioner Leak, seconded by Commissioner Jarrell. So at this time, if you would please express your vote. Commissioner Cotham.
No.
Are we going to have discussion on the motion first?
I'm sorry.
Exactly.
I'm sorry. My apologies. Discussion. I still have to go through the same order. Commissioner Cotham.
Thank you, Mr. Chairman. I appreciate the opportunity to speak on this. I have been, during this meeting, I continually have heard wonderful comments, heartfelt comments from my colleagues, from our staff, from our guests about our most vulnerable people in Mecklenburg County. And, two times, and we've heard it before, Commissioner Leak eloquently said, is anyone listening? Does anybody care? And I just think the tone of all of that has changed now with this. These are our small business people, and there is a big variety among that group. They are not all the same. They do not all have P&L statements that are easily accessed. Many of them, as I think of people I have known over the years, maybe some man, I remember one man, Manuel, who was from Mecklenburg County, and he, when he left prison, he started a tree cutting business, and I have used him to cut some trees in my yard. And he has, some equipment, a truck, a couple guys. that's his business. I doubt if he has a QuickBooks, and I'm sure he doesn't have, like I said, a P&L statement. And there are many of these types of businesses, whether they're caterers or salons, that are just very, very small. And I just worry that they are going to be left behind. I worry that when I read things in this document about, first come, first served, and all of the hurdles they have to jump. And to them, it is a hurdle. By the time they would get some of these things that are needed, the money will be all gone. And that worries me tremendously. I did not hear anything in this document or hear anything from the speaker about education on this for these business owners. If they were lucky enough to get some of this money, and are they going to get the education on how to help them use it so that they can be open? Because to them, an immediate need might be paying the payroll of people or paying rent. And they may think, well, I won't have to, Duke Energy is going to let me slide for a while. Well, they don't need to have, if a caterer has a bill of $800 a month, which many of them do because of refrigeration and ovens, then if in 3 months, that could be $2,400. That could put that person out of business. I really worry about not getting enough help with this money. I also worry about the third party. I think that is wasteful spending. $1 million for a possible 142 people. That's only like half of a percentage point of we have like 30,000 businesses, and this is talking about 142 users. I do not understand that. If we did not use them and had that $1 million, that would make 28 more companies get $35,000, or 100 companies getting 10,000, 100 more companies getting 10,000. And I still struggle with this third party to only do 142. I feel like we have, and they don't know these businesses. They don't have relationships. We already have groups in place with our minority chambers, with the Asian chamber and Hispanic, the LGBT chamber, the African American chamber. We have women's groups. We have all kinds of that could do this work and save that money so that more of our businesses could get relief. Because I just worry that they're going to use Commissioner Leake's phrase and say, is anybody listening? Does anybody care? I also worry that these are loans, and there's no part of this that is forgivable. So I have certainly talked to big small businesses, if I can say it like that, a business that could be multi-millions of dollars, but are still considered a small business. And they will be able to get money from the federal government. They have people in place that can put these mechanisms in place of things that they need to provide. But a small business, an independent, a handyman, they don't have that. They're not going to be able to do that. And I really feel like we're missing out on them. We're not as concerned about them as we are concerned about what we spoke about earlier, about their health, and keep this to be grants and forgivable loans, because multi-million-dollar businesses are going to be getting forgivable loans. And it's the same thing that Commissioner Jarrell said and Commissioner Leake said about the African American community. They don't get a cold, they get pneumonia. And I think this is the pneumonia. And I just think we can do a whole lot better. I think we can do more, and I think we can make it more efficient by using the groups that are close to these people, who know them and who can help them and who will be with them from the beginning to the end. And I know my time is running out, so I feel strongly about this, and I want the small business people to know that I hear them. I have heard them. I've taken their calls. I will be there And I thank you for allowing me to speak on this. Thank you, sir. I'm finished with my comments.
Okay. Commissioner Fuller.
Mr. Dunlap.
Commissioner Fuller.
Okay.
Madam Clerk, can you mute everybody other than the speaker? Commissioner Fuller? Is Commissioner Fuller not there? All right, Commissioner Scarborough.
Was talking. Somebody must have muted me. Can you hear me?
Yes, go ahead.
All right, thank you. So, look, I think we need to do something for our small businesses. I too get calls and emails from people who are really worried about being very vulnerable, particularly small businesses, 1 and 2 people, or up to 10 people who really are worried. They want to do right. They want to do right by their employees, but this is really really hurting them. So I think we need to do something. There's no doubt about that. I am concerned about this proposal, and I understand all the emergency that we have to respect, but I too was taken aback by the amount of money for administration. Essentially, what it seems like is at least $500,000 for administration. And that concerns me greatly. The other thing I saw was that a person is eligible if their business is in Mecklenburg or if their principal is in Mecklenburg, meaning that if their principal is in Mecklenburg, but their business is in Union or in South Carolina, that we would be supporting that. I don't agree with that at all. And you know, this whole program is essentially, let's just say what it is. It is a giveaway. And what's going to happen is you're going to have a rush to the trough. And because the requirements are so little, we're essentially just going to be giving money to people. And so what that means is that you have to know about it, and then you've got to have the ability to get there first. Now, what's the history when that situation occurs? Most of the people who we think we're going to be helping, those who are in the greatest need, will be left behind once again, because they're not going to be able to get there quick enough. They're not going to be able to get their papers together quick enough. And so once again, we are picking winners and losers. Now, I don't know what the answer is to that. And on that issue, I would like to have had some time to have had some discussion about this with staff before we have this as a decision point for us to be making. I mean, we're talking about $5 million that we're ready to vote on tonight after the space of about a half hour or an hour. And I worry about that. And people are going to ask, once again, we always find a way to help those who have. Always find a way, and always can justify it. And it's always an emergency, and we got to do it. But the people who wind up getting it are not those who we say we're supposed to be getting this money to. Now, I don't deny at all that we need to do this. I'm not even questioning the $5 million amount. I'm not questioning. What I am questioning, and what my main concern is who's going to get these dollars. And I don't have any assurance from what I've seen so far that the people who are most in need are going to get it. So the other concern I have is that, you know, one of the expenses that you can use this loan for is payroll. But, you know, if people are not working, if employees are not employed and the business otherwise doesn't have any kind of leave policies, they're not, the money's not going to get to people. That's my concern, it getting to people who really need it. People are out of work. We need to help them too. And I don't see us moving with the same kind of speed, the same kind of emergency to help those folks, individuals who go to work every day and are out of a job, not for their own, but because of this pandemic. And I think we need to help those people. I think we need to help small businesses too, but I don't want to duplicate funds that are coming from other places. As was just mentioned, you know, many of these small businesses who are going to be able to get there first also are going to be able to, and probably have already sought money under this $2 trillion federal act. So I don't know. I mean, I suppose I'll. Anyway, those are my comments. Thank you.
All right, Commissioner Harden.
Before you move on, Commissioner Dunlap, just let me clarify one point that I heard Commissioner Cotham say. Under these types of provisions, under the law, North Carolina cannot, local governments cannot give a forgivable loan. It violates the North Carolina Constitution. This is more driven by economic development within the community because of this COVID incident. If we were to give a loan that was forgivable, that could potentially be an exclusive emolument that would violate the law.
Thank you for sharing that. I was going to share that, and I was also going to say that Mecklenburg County cannot directly loan. That's why we have to go to a third-party vendor. But at this time, let me yield to Peter to respond to what he's heard thus far.
Thank you, Mr. Chairman, and thank you, Mr. Wade. Your comment was specifically was one I was going to specifically address. We looked at a number of different tools, and we are very much hamstrung by state law. We cannot give grants. We'd love to. I think there are opportunities to do that. If the funding source is general fund dollars, we are simply hamstrung and unable to do that. As far as using our third-party loan administrator, we are proposing using Carolina Small Business Development Fund. They have deep roots within the community. They are our existing small business loan provider. You may be aware from some of the reports that we have been sending to the county manager and to the Board of County Commissioners that they have already started lending funds from that. We saw that in Chairman Dunlap's State of the County address. As far as the funding going forward, yes, there is $1 million ask for the services for Carolina Small Business Development Fund, but we need to kind of understand what that $500,000 is for. That million is for $500,000 of it goes specifically to some of the support and training going to the lender, going to the borrowers, as was asked about. The comment was made that how do we know that once these businesses borrow this money that they're going to continue operating? $500,000 of that $1 million does go directly to supporting them. As far as the cost for a third-party administrator, this works out to about $3,000 per loan if the loan fund is maxed out, that we would be paying them to complete the loans. That's everything from loan origination, loan application, loan underwriting through 10 years of loan servicing and bill collecting. That does not include the significant number of applications they're likely to receive that are not eligible. So when you begin looking at it on a per action level, that $500,000 is diluted pretty quickly. I don't think we would have the capacity to find other community organizations that can receive loan applications, apply consistent underwriting standards, and then service the loan for the next 10 years. That really is the role of a CDFI. And when we went through the process of selecting a vendor for the small business loan fund, this was the only CDFI that we found that had the capacity to do all the regulatory compliance and regulatory actions needed to run a respectable loan fund.
Okay, thank you for that. Commissioner Harden.
Thank you, Chairman. I guess I have to tell you, I mean, the small business community is literally devastated. Literally devastated. I get calls every day from small business people saying, I have seen everything that I've worked for my whole life come to a screeching halt. And they're trying desperately to keep employees on the payroll till we get past this self-quarantining and stay in place time. I am going to vote for this. I can't imagine what small business is going through right now. So many of them are, especially the ones that are considered non-essential. You know, I hear from them, you know, especially, you know, I'm willing to do this because I care about my community and I care especially about the seniors in my community, and I'm willing to do this. We have to show up for them. And so I'm going to, I appreciate the work that the county manager has done putting together this program. I think that I would ask in its administration. I looked at this Carolina Small Business Development Fund, and I was completely impressed with the supports that they have to support diverse types of audiences and businesses. If you look at their website, you see that deep commitment to making sure to diversity. I can tell you that. So I appreciate the. I appreciate the concern about the third-party vendor. Once I just literally looked at what they've done since 1990 and the infrastructure they have, I completely understand what Peter said about that. Anyway, through our decisions, we literally stopped business. And I think we have to provide the bridge loans and bridge support small business need to get through this crisis. Thank you, Mr. Chairman.
Thank you, Commissioner Jarrell.
Thank you, Mr. Chairman. Peter, thank you for the presentation. A couple of things I want to understand, Peter. Who sets the underwriting guidelines? Is it us?
Yes, we have been working collaboratively with the staff at Carolina Small Business Development Fund on those underwriting standards.
But ultimately, we're responsible for the underwriting guidelines, correct?
Yes, they will administer the guidelines that we ask them to.
Okay, fantastic. So a couple pieces. One, you know, I want to say that small businesses have received absolutely zero, nothing. There's been a lot of talk from the feds, a lot of programs to apply for. And it is imperative. I mean, we are at critical mass right now. We've got to get money pumped into these small businesses. We have to do it the right way as well. I think low interest loans are certainly fine. I think when you look at the amortization schedule that you guys have laid out, I think it is, you know, I totally agree with that. One of the things, though, that I would like for us to look at, though, the collateral requirement under the loan terms as far as the UCC filing, don't understand why we need to have that. That seems a little out of bounds. You know, so I'd like us to look at that. The other requirement that I would like us to look at is also alternative means of documentation. So if we're looking, Commissioner Cotham raised a point where there's going to be several people, a lot of businesses that are going to be in that situation. So I'd like for us, as we're setting these underwriting guidelines, to be able to allow for one, alternative documentation in lieu of some of the requirements as far as P&L statement, and then the second thing would be for us to try to look at these loans some of them on a case-by-case basis if they're not, if they don't meet all of the requirements, because to a lot of the concern in the community is that certain groups will not be able to benefit from this, and because of maybe some of the requirements. And I will concede the point, though, that I mean, these requirements are, pretty streamlined, and I like the ability for us to get these cash in hand within 10 days. But I do think a couple of tweaks would allow for some of my colleagues to feel more comfortable around ensuring that the maximum number of people get the funding. So I'll let you respond to that, and then I'll go on to my final point.
Thank you. I do know that some of the representatives of Carolina Small Business Development Fund are watching this or listening to this. So we will begin immediately having that conversation tomorrow morning with them about what we can do on some of those underwriting standards. We're certainly happy to take that under advisement. I do want to make sure that folks understand that we are planning a comprehensive marketing of this program. We're going to be using our small business concierge and our small business capital access programs to send email blasts out to over 10,000 small businesses that we've interacted with. We are working with the PI, the Public Information Office, to make sure we're getting into Lonoticia and all the other non-traditional medias that we can get to make sure that this is advertised far and wide, and we've got deep reach into the community, as well as relying on Carolina Small Businesses' existing network into the community.
Yes, so one, I think we've got a ton of chambers. We have the Asian Chamber, Black Business Owners of Charlotte, LGBTQ Chamber, who did an extensive review of this and provided some really, really good recommendations as well. We have the Latin Chamber, of course, Latin American Chamber. So, I mean, really, really making sure we drill down with some of these groups to understand some of the barriers that we may not have visibility to, I think is extremely important. But I would say for tonight, I know you said we would take it under advisement. I guess I might have to make a substitute motion if we're saying that we could not come to some agreement on these underwriting guidelines. We have got to make sure before we get off of this call tonight that everybody that we intend to help will have access to these funds. And so I appreciate the communication effort, but I certainly want to make sure that some of these guidelines, particularly in this crisis situation, does not become a barrier to the many business owners in the community. And so, again, my ask is for alternative documentation and for us to be able to take it on a case-by-case basis as we're looking through this. And, I just really believe that is important. And the final point, what we're doing right now does not preclude us, and this is the general question, does not preclude us from adding more money to this program. Is that correct?
Thank you for teeing that up for me. Absolutely, this does not preclude us from adding more funding. Part of the thought process of making sure this was with a respectable CDFI is that if we do encounter philanthropic communities or individuals that want to contribute funds, if there are other government agencies such as the City of Charlotte that want to contribute funds, this is a standalone fund over at the CDFI that others would be able to contribute to. Then on that back end, as we potentially added more, if we were to add more dollars to it and others were able to put money into commingle, we would have agreements structured that we would make sure that the capital was returning back to the appropriate folks as it was captured.
Peter, at what detail and what frequency will we receive reporting on funding? Obviously, keeping in mind that, of course, personal information is private, but there's certain details that I think the board would want to see, and we want to see the frequency to make sure that the funding is going as planned, so that we don't get any blowback from the community saying, hey, I've applied, but it's 21 days or it's 35 days, as opposed to the 10 days that we're communicating tonight?
Our anticipation is that we would be on the same cadence of reporting, which is monthly reporting in terms of number of applications received and the status of those applications, as well as quarterly reports on the performance of the fund. We can certainly work with Carolina Small Business Development Fund to get a little bit earlier reporting on that. Candidly, if the Golden Leaf experience it holds true for this, we may be, these funds may be depleted within less than 30 days. So we would certainly know the number of applications, the number of loans that have been approved, and the rate at which and the length of time it takes to get those loans out onto the street.
But I think that's my point being, understanding that how the funds can be depleted very quickly. I think it's imperative that we're in a position to act very quickly so that we can decrease the lag time between funding for these businesses. So the reporting, in my mind, really needs to be much faster. It needs to be at a greater frequency to start out with so that we can act quickly. And so I'd ask that we could go back and discuss that so that
Sure.
we're in a position to act quickly. And then the final point is, and we also need to be able to report out and understand and let our constituents know that, this fund, people are utilizing the fund. So thank you, Mr. Chairman. That's all my comments.
If I may, just to give you an indication, Commissioner, I'm actually I've got 3 text conversations going on, not only with CDFI, but with Fred Timo in our office. The feeling that we are getting from Carolina Small Business right now is that it looks like we can do some alternative documentation like you are requesting. We just need to sit down together tomorrow morning and understand what that is and finalize what that would be besides P&Ls. We are getting a guarantee that that the Carolina Small Business Fund will be flexible on the underwriting guidelines, and that Fred is indicating that we may be able to relax the Universal Commercial Code underwriting.
That UCC lead is very important. Yes. So thank you for that. That's extremely important. That could really hurt a business. So thank you.
So I'm anticipating that we're probably going to get daily informal updates from Carolina Small Business Fund that says we've received 100 applications today or 50 applications or whatever those numbers are. So we'll be getting a sense of how many are coming in and what the loan amounts are. I think within 4 or 5 days, we're going to have a good sense of how this is operating.
And Peter, can you make sure that our UCC lien requirement does not impede the business owner from getting loans from the SBA program or any other programs that are out there? Can you make sure that that's not going to be an impediment if we're not able to adjust?
We'll double check that in the morning. Yes.
All right. Thank you, Mr. Chairman. I'm done.
All right. Commissioner Leak.
Thank you, Mr. Chairman. I believe Mark Jarrell asked every question in the book that was to be asked about the program. But are you hearing me?
Yes.
Joyce, are you hearing me?
I am.
All right, well then respond. The concern I have and what I've heard is the term of trust along the lines of providing for small businesses to be able to maintain some degree of presence in this community. And that we have not seen, nor have we had that out there in the first place. So the question is, what's going to make it different from what has been in the past? That the big guys will come in and use up the funds and be able to get the funds because of their uniqueness in knowing what to do and how to do it. So tell me, who helped to draw up these plans?
This is Peter Zeiler. This was a joint effort with Fred Timo and myself within the Office of Economic Development. It was also based on numerous discussions with CDFIs, lenders, and small businesses throughout the community as they called, requesting assistance for funding.
And how many of those businesses were minority business, Black businesses?
I'm not sure we have that count. We have gotten literally hundreds of calls and have not been able to track that as they've come.
You have included them in the process. Not
We have
the
included
the process.
We have included the small businesses that have been calling into us, but we have not been able to track how many of those were minority businesses or not.
Well, seemingly you would have, because that's what we're trying to do, is to support the small business people in this community. And I'm not hearing that. Nor have I seen it or heard it since I've been on the county commissioners. So that's why I'm saying the word trust is out there, and there's some concern about, you said 2 individuals and then an agency helped you draw up this plan?
It has been the Office of Economic Development staff, along with our lending partner, Carolina Small Business Development Fund, as well as input from dozens, if not hundreds, of small businesses that have sent us emails and phone calls telling us what their specific issues are and what they are encountering in not being able to get funding from the SBA or the Golden Leaf Foundation. So it is feedback not only from county staff, from our vendor, but also from the hundreds of small businesses that have been reaching out to us on it since the COVID-19 pandemic has started.
That's what I asked at the very beginning, how many Black businesses were a part of the planning of setting up this process. Small businesses are the thing that keeps our community going. And I'm not sure that all has been put in place to enhance the small businessman with the corner grocery store, with the barber shop. And the other piece to it, people are not going to get ready to go back to work until we lift that barrier of staying at home. So how are we going to be able to undergird these people until then, until they go back to work and people are coming in? Are you there?
Yes, I am here. The challenge here is there are a number of responses coming from the federal government that are providing support to workers. This is really designed for small businesses that are still operating but are threatened with going out of business because of the impacts that we've already discussed.
You said this is geared specifically to small business that's still in operation. Is that what you're saying?
Yes, ma'am.
So their doors are open today?
Their doors are open today. They may not be, they may be a restaurant that has been temporarily closed, but if they're still able to operate, that is the type of company we are looking to support. Again, no company with more than...
This is the problem I'm having. Sorry to cut you off, but this is the problem I'm having, in that they did not have anything to sustain them in the first place. And you're saying to me only those businesses who are able now to sustain themselves until this motion is passed. And I'm about not to support this motion right here. And I'm asking the board members not to support it until it's a better plan for the people who need it the most.
Okay,
and I'm not seeing that, and I have not felt that from the economic committee or that group, when we have people talking to us every day and monthly. And the only people who come from your office are people that look like me.
All right.
So you cannot say to me that you've got the feel of the people who look like me in this process.
So if I may clarify, this really is for businesses that have been affected by COVID. Their doors may be closed currently.
I'm talking about that too. So I don't think I can support this. I cannot support it.
Okay, Commissioner. Moving on, Commissioner Powell.
Did you stop me in 7 minutes like you did the rest of them?
Yes, ma'am, I did. Commissioner Powell.
No, you didn't. No, you didn't.
Madam Clerk, if you'll mute those people who are not speaking. Commissioner Powell.
Hello, this is Commissioner Powell. Peter, I have a question about why did you choose the minimum, like that they have to get a minimum loan of $10,000?
The minimum loan was really around trying to understand what other opportunities are out there. And I think you're going to hear from Tim Tibbs that there are other opportunities in the sub $10,000 range. We're really trying to get folks that could benefit from this that were not being served by other products in the market right now.
Okay, so later Tim's going to talk about people that might not need 10,000.
That is correct. We also looked at the fact that what is the best mix and utilization of the funds in terms of being able to support businesses.
Okay, thank you for that. And what did you say? I didn't hear you finish on the number of employees required.
The maximum number is 50 employees. The minimum number is 1.
Okay. And so I agree with every question and comment from Commissioner. I think I would support his alternate motion whenever we get to that. And those are all my questions.
Okay, Commissioner Susan Rodriguez-McDowell.
Thank you, Mr. Chairman. Yeah, a lot of questions have already been asked and answered that I had. I do really still feel concerned about the price per loan. I mean, that just seems an exorbitant amount that the county is. So if I'm understanding it correctly, the county is covering the $3,000 per loan. So the interest, I know it's a very small amount of interest, 3%. That's going to the loan, the Carolina Small Business Development Company, right? That they get the 3% plus our $3,000 per loan. Is that correct?
No, that is incorrect.
Okay.
The 2.5% of the loan will come back. 2.5% interest will come back to the county along with the principal from the lend.
Okay.
0.5% will stay with Carolina Small Business as part of their processing long term as they hold these loans over the next 10 years.
Okay. I'm also really concerned about, we're talking about 142 businesses out of, you originally said there was 29,000 small businesses that fall into this category, but we're only looking to help you. And so I'm just wondering, do we have anything to say to the, 28,000, I haven't done the math, the other 28,000 plus businesses, I'm trying to.
Excuse me, Madam Clerk. Can you mute Commissioner Scarborough's phone?
Yes, we'll mute that.
Thank you. Okay, Susan, I'm sorry.
That's okay. I just really want us to speak to at some point how we are going to speak to the other businesses that aren't going to get these 142 loans. Like, I just think it's such a drop in the bucket. And I'm not saying that, I'm not even sure what the alternative is, but what I'm saying is this is such a crisis for so many people, and this just doesn't touch it. It's like putting a Band-Aid on, or it's not even big enough to be called a Band-Aid. It's so tiny. And so I'm really concerned about that. And so I'm glad that Commissioner Powell asked about why the minimum is 10,000. So I'm looking forward to hearing what Timothy Tibbs has to say. But I also wanted to just make sure immigrant businesses have an opportunity for these loans. Is that correct? Because I didn't see anything in the requirements that an immigrant business wouldn't be able to meet. Is that right?
Yes, there is no reason that an immigrant or minority business owner would be able to access these funds. Again, we're going to do as broad an outreach as we can. There was mention of a number of the minority chambers of commerce. We're going to use every avenue available to us to be able to promote this as widely through as many communities, diverse communities as we can.
Okay, I really appreciate that you said that again. You repeated about how you're advertising to all of these different communities, but it almost feels cruel. It really feels cruel to do an email blast to 10,000 businesses when there's only 142 loans available. So I'm just having a hard time reconciling the great need that we have with our answer to it. So I don't know if there's any way to, I understand why we don't want to have too many obstacles for folks to be able to get these loans, but to be able to verify that the people who are getting the loans really need the loans. And you know what I'm saying? Like how you demonstrate need. I just don't know if we can do that. But anyway, that's the end of my comments. I feel troubled by this, but I think I need to support it. But I also want to say, what else are we going to do? What how are we going to help people? This just doesn't touch it. So thank you, Mr. Chairman.
Commissioner Scarborough.
Yeah, my phone was on mute. Yes, I'm concerned that we're not inclusive of people that really need to be included on this conversation, and also that we need to ensure that we're just not picking out people because either they're friends or we know them. We've got to find people who really need to be able to, in small businesses, be able to do this stuff. Because I do know some who are, who really need money to start their small businesses and to continue. But we've been talking, I've been listening for a while, but we've been talking about people who I don't know that they have small businesses and also that they need any support with it. So I think to do this, we, the Board of County Commissioners, need to be we need to be in a room talking to each other, seeing every one of these requests and ensuring that these requests are legitimate. Otherwise, we're going to make some of our parishioners very angry with us. And so I don't want that to happen. I really don't. I know that there are people who need loans. I know people who need help, and we need to do it. But we ought to be very careful on how we do this and how we actually pull out one person over the other. So I'm concerned about how this is going. But I wasn't in on all the entire thing, but I wanted to be sure that I when I came in about an hour ago, that I actually found out what y'all were doing. So anyway.
Okay, thank you, Commissioner Scarborough. Let me just make a couple of comments and then tell you what our options are in order for us to move forward. First of all, I hope everybody looked at the agenda to the point that you realize that there is another process that is being proposed that is tailored to micro businesses. So when we talk about barbershops, beauty shops, caterer business, those are micro businesses. They are not the 50-person businesses. So there's a totally separate loan proposal package for them than it is for small businesses. Small businesses are for those businesses up to 50 people. I want to make sure that we understand that. The other thing is that while we may be concerned about the cost of the loans themselves, Mecklenburg County cannot directly lend to a business owner. We don't have any choice but to use a third-party lender. We went through an exhaustive process about a year and a half ago to find a company that could do this, which is the company that Peter speaks of. So nobody's going to do it better. The other thing, I hope you heard Peter say that he was in communication with these folk who are willing to make amendments to what is currently being posed to assist in doing some of the things that you feel are important. One of the concerns I have is that I don't want people to be able to get a loan here and a loan there when some people don't have access to any loans. So I think we should take into consideration whether or not people were able to get a federal loan and support those who didn't get any loan. Double dipping, for me, doesn't work. So there probably needs to be some conversation around that. I believe that the alternative verifiable information might help us target some of the people that we're concerned about. What that looks like, I don't know. But this is what I do know. If we don't agree upon something tonight, there will be another 2 weeks before we meet and can take action. So Mark had an idea that he has not yet put into a substitute motion that I hope he will, that might get us to the point that we can put in place what is being proposed tonight, accepting the fact that Peter has heard some concerns and he will work with the vendor to address some of those concerns. Or we can wait, hash all of this stuff out between now and 2 weeks from now, and then come back and have this debate and discussion again to see whether or not we're then prepared to deal with this. But what I thought I heard tonight was some urgency in helping people who needed help. This is not going to be perfect by any stretch of the imagination. So my hope is that, Mark, you will offer a substitute motion to amend that portion that talks about the requirements, that we can support it. And then at a later time, if we deem that we need to make additional dollars to this fund, we can do that. But keep in mind, the federal government, who has a whole lot more money than us, probably won't touch as many as us. It's just that simple. Okay, so what is your pleasure?
Mr. Chairman, I'd like to offer a substitute motion at this time.
All right, Mr. Jarrell.
Okay, Mr. Chairman, members of the board, I'd like to offer a substitute motion on the action that we're going to take. I want to adopt sections A, B, C, and D, but add the first requirement is to remove the UCC filing on business assets, and also for the underwriting guidelines to provide for alternative documentation in lieu of the P&L statements and other requirements.
Okay, there's a motion. Is there a second?
This is Commissioner Powell. Can I ask Tyrone a question?
Wait a minute, because the motion dies if there's not a second.
I'd like to second, Chairman.
All right, so it's been moved and properly second. Now discussion.
Yes, Commissioner.
So Tyrone, if if I wanted to add to Commissioner Jarrell's motion to say that a minimum loan could be $5,000, how do I do that?
You would have to ask if he would entertain a friendly amendment to his substitute motion.
Would you entertain that friendly amendment to decrease the minimum to 5,000?
Yes.
Okay, so let me ask a question of Peter. Is the lending agency prepared to do that, or can they do that?
Yes, we have an operating memorandum of understanding, or term sheet, I should say, that we have been passing back and forth between Carolina Small Business and the Office of Economic Development. We can certainly do that. We can take all that we have heard about removing the UCC, which in conversations with Fred already, we think we can accomplish that. I think we could commit to that right now. The alternative documentation, I'm getting messages from Carolina Small Business that is already proposing what some of those may look like. And certainly we can move to a $5,000 minimum loan if that is the board's pleasure.
Okay, Commissioner Jarrell accepted a friendly amendment. The seconder of that motion, Commissioner Harding, you're seconding that amendment. Commissioner Harding?
I'm sorry. I did second that amendment. What were you asking, Chairman? I'm sorry.
There was a friendly amendment to the original amendment, which Marks agreed to. You were the seconder on the motion.
I agreed to that friendly amendment.
All right. Now, is there any further discussion?
I haven't read it.
Yes, I have a question, Mr. Chairman. This is Commissioner Rodriguez McDowell.
Hold up, Commissioner Leak first.
Oh, sorry.
Thank you. My question is, and it's generic, the trust level that's out there, how do we correct that with what we're getting ready to do? That's a part of my concern. And to say to me that this is the only company that can do this in the country. So that's not true. The lending tree, that's not true. So I want to know how many companies did we investigate that could do this process for us?
Commissioner Leak, well, first of all, they didn't say the lending tree. And second of all, this is the business that the county commissioners vetted to do this work.
What company is going to be handling this, George?
Carolina, tell them, Peter.
It is the Carolina Small Business Development Fund. It is the same company that is doing our existing small business loan program. You may recall that we came to the Small Business Consortium and rolled out that loan product a few months ago with representatives from Carolina Small Business as well as Fred from our office.
And you did have questions from the people there then. So don't get upset with me because I asked the question, said lending tree. I made a mistake. So thank you for correcting me, but I still say the problem of trust in this whole process. And as I think about it, should I support it or should I not support it? And I certainly do agree with what all that, we probably knew this when we were coming in here for the meeting tonight anyway, that Mark Jarrell was going to have a substitute motion. So in that being said, thank you for the opportunity.
Okay, Commissioner Susan Rodriguez McDowell.
Thank you, Mr. Chairman. My question is, if the loan amount is reduced, if some people can get a $5,000 loan, I certainly hope that the fee would not be the same. Like you wouldn't want to pay a $3,000 fee on, well, you wouldn't want to pay that on a $10,000 loan or a $5,000 loan. So I'm just concerned about that. Can we speak to that?
Let me be clear that it is a flat $500,000 fee for all activity related to the lending program. So that is all the loans that are received and vetted, whether they are underwritten or not. That is all the underwriting for all the loans, and that is all the loan administration going forward. So if we have 200 loans, assuming maybe we get an average loan size of $20,000. When you start doing that, if you take that amount, that per loan amount begins to drop. So it's not a fee we're paying per application or per closed loan. It is a flat fee for all activity, including marketing, outreach, creation of collateral material, creation of their website, all the staff time to take phone calls from people who may be interested in the loan and then decide not to go through with the loan. All the activity required to put the $5 million out is covered by that $500,000. The other $500,000 then is reserved for ongoing technical support, training, and assistance for those lenders those borrowers that do get funding through this fund.
All right.
Okay.
Mr. Chairman?
Yes, Commissioner Fuller.
Yes, I have a friendly amendment to propose to the motion. Might I suggest that instead of adding an action E, that we amend letter A, authorizing the county manager to negotiate and execute the contract with this fund, taking into account the issues that Commissioner Jarrell mentioned, and three other items that I would want to be reflected. One, that a loan not go to a person who lives in Mecklenburg but has their business in some other county. I don't think Mecklenburg dollars should go for that. Number two, that there's no duplication between the funds that somebody gets from this fund and other programs there might be. And then finally, some kind of general statement or assurance that the loans that are given will be equitable in nature. I think that's the general.
I second that motion. That substitute motion.
So would you accept that as an amendment?
Need clarification. I'm sorry, Commissioner Fuller, I need clarification on one point on your part B. Are you saying that if a small business takes advantage of the stabilization loan fund, that they would not be able to apply for the SBA EIDL or the SBA PPP programs or any other programs that come out?
Well,
is that what you're saying?
I'm not being that specific. I want to say, I just want to have the principle in there of no duplication. Now, the county manager can massage that, can negotiate language with the fund that could reach that goal. I didn't want to be that specific to say that you may not under any circumstance.
But A and C, I would accept A and C. B, I would not. We're talking $35,000. The businesses that we're targeting on this fund have gross revenues well over that and need as much funding as humanly possible right now. And I think we've got to not try to, nuance this thing to death where, we think people are going to be getting rich off of this. I mean, they need funding desperately. And to a lot of these businesses, I mean, 35,000 is just a week's worth of gross revenues. And we're talking gross revenues. We're not even talking, net. So I would ask you to just reconsider that portion but I'm prepared to accept A and C because I think, that's more than reasonable what you're proposing there.
Can I intervene here just for a minute? I think, one of the reasons why we wanted to put this in place is because we are so nimble that we have the ability to get money out the door quickly. And when folks apply for SBA relief and all of that, there's a big time lag there. We wanted people to have a longer runway. It was never intended that if you apply for our program, that you would be prohibited from applying for other programs. That was never the intent. We wanted to get money out the door to help small businesses stay in place while they go through the process of trying to obtain funding from these other sources. So I just put that out there as sort of what we were thinking as staff when we put this together.
Well, and if I may, Mr. Chairman, I certainly respect that, and I agree that the urgency is more important. The thing I'm really trying to address, though, is really something that Commissioner Rodriguez McDowell just mentioned, which is this is already such a drop in the bucket that I wanted to go to as far as we can spread it. And I know people can get loans from different sources, but I really think we need to spread this money as far as we can spread it. And I'm just concerned about people being able to double dip. And I don't know whether it's a prohibition on it, maybe not that, but something that would discourage double dipping when we're trying to meet the needs of so many people to do this. So if Commissioner Durrell would accept the other parts of my friendly amendment, I'd be willing to accept that.
Would accept the part A and C, but not B, Commissioner Fuller.
Right, and the other things that you mentioned being in A.
Correct. In addition with, that I think that's reasonable for sure, and what Commissioner Powell put in there as well.
Okay. Again, Commissioner Fuller shared my concern about the ability to be able to spread it as far and wide as possible, as opposed to a small number of people getting 2 or 3 loans and some people not getting in at all. But in order to move this forward, because we do have an opportunity to come back at a later time to revise the amount of funds that have been attributed, if there are no other concerns, we'll move forward with the vote on the substitute motion, which is actually an amended substitute motion from Commissioner Durrell's substitute motion.
Which becomes the form of a main motion that has been substituted.
Right. Okay. Right. So I am calling the question on the main motion now. Commissioner Cotham, how do you vote? Commissioner Cotham?
No.
Okay. Commissioner Fuller?
Aye.
Commissioner Harden? Commissioner Harden?
Aye.
Commissioner Durrell?
Aye.
Commissioner Leak?
Halfway aye.
Commissioner Powell?
Yes.
Commissioner Susan Rodriguez McDowell?
Aye.
Commissioner Scarborough?
Aye.
And I vote in support. All right, thank you. Motion carries. Is that 8-1, Madam Clerk?
That is correct. 8-1, it passes.
All right, thank you. So at this time, we'll move to the county manager again for her additional update.
Thank you, Mr. Chairman. The next item on the agenda tonight is to receive information and getting a vote to move forward with the Micro Business Stabilization Fund. And with that, I will turn it over to Tim Tibbs.
Good evening. Thank you, Chair Dunlap and board members. Thank you, County Manager Diorio. I want to take just a few minutes to discuss the Micro Business Stabilization Fund that will provide emergency relief for micro businesses, which are businesses that employ between 1 and 5 employees. I'm hoping that this will fill at least somewhat the need that we're discussing this evening. With this fund, we anticipate providing support for businesses like the local barber or hairdresser, the small accountant, or maybe even the small dry cleaner or specialty retail shop owner. For context, a few weeks ago, HUD provided guidance to its grantees on how to quickly use community development block grant funds to support COVID-19 and other infectious diseases. As you may be aware, the county has participated with HUD's entitlement program since 2009. Our program is limited to only the towns, with the exception of Mint Hill and the unincorporated areas of the county. The city of Charlotte receives CDBG funding, which serves their geography, which is much larger. I think in their main allocation for the this fiscal year, they received $3.5 million. And with the new CARES Act, I think they're getting an additional 1.2 in COVID funding. So it is important to remember that as we have this discussion, these funds are only available to our CDG program area. In response to the urgent needs in our community, staff worked with the towns and Central Carolina Council of Governments to quickly identify $533,000 of currently allocated CDBG funding that is being programmed to create this micro business stabilization fund. Yesterday, we received a letter from HUD that gave us notice that HUD was going to give us an additional $467,000 from the Coronavirus Aid Relief and Economic Security Act, or CARES, specifically to prevent, prepare for, and respond to the coronavirus. This brings the total amount to about $1 million that we can support in micro businesses in funds that we can get out the door rather quickly. In order to respond quickly to the needs of our small business community, we have added a request that you authorize the county manager to amend our FY19 and FY20 CDBG annual action plans per HUD's guidelines to allocate funds to create the micro business stabilization fund. Due to the letter being received yesterday, this was not in your agenda packet materials that have been received at this point. And I apologize for that. So I have provided an overview of the stabilization fund in your materials, but I'm going to highlight just a few points for you and the public. The program will provide loans up to $10,000 to qualifying businesses on a first come, first basis. And if approved, the funds will be available within 10 days of receipt of application until exhausted. Loans may be used to cover day-to-day operating expenses such as payroll costs, including benefits, interest on mortgages and mortgages, rent and utilities. No collateral or personal guarantees are required, and businesses will not be charged fees. The program will be managed through the Central Carolina Council of Governments, which currently administers the county CDBG program. Therefore, once applications are received, the COG will process applications and review while county staff approve the application. The good thing about this is as we reprogram funds, they're able to do this administration at a minimal cost based on our conversations now, and they've been very flexible and helpful. So some loan details. Applicants or business owners must meet HUD's guidelines for qualifications for it to be considered low or moderate income. The business owner or 51% of employees must be qualified as low or moderate income, which is based on family size and earnings which must be less than or equal to 80% of the Charlotte-Mecklenburg MSA area median income, which is currently $83,500. The business must have experienced a loss of income due to COVID-19 and provide supporting documentation, such as tax returns, financial statements, gross receipts, and other financial data. So I want to give you just a kind of an example. We're going to use a barbershop example. A barber can no longer see her clients. We'll call her Kate, and she can show that she's been negatively affected by COVID. First, she must qualify as low moderate income as determined by HUD, which is based on earnings and family size. She applies for assistance for her rent, which is $1,200 a month, and utilities, which is $300 a month. We would take those, multiply by 2, and her loan amount would be $3,000 for her. So we're looking at that in this example, just simple math, around 166 at that point, and if we get to 333 rather. I was thinking about the half million. So 333 businesses we could positively affect with that example. So that's just to kind of let you know. And if you look at our loan details, it's very simple. It's not something that is difficult for businesses to navigate. The application will be available online Monday, April 13th. And again, we anticipate being able to start paying funds out 10 days after the application is completed. And we have more information available by visiting mecnc.gov. And if approved, this will be available once you all approve and we move forward. We are working closely with public information, town representatives, and other community and faith-based organizations to spread the word so that the small business community is well represented. We've heard you tonight. I've been communicating with Lawrence Corley, and we're very serious about making sure that we use both the conventional methods, and we're really going to try hard to reach out to the churches, reach out to all of our partners, and make sure that the information is available and people are set up that may not normally even engage in local government so that they can be responsive. So we're going to keep you informed. I think that we could probably provide you updates on twice a month updates just to kind of let you know where we're going, and then monthly. But again, we are asking that you authorize the county manager to amend the FY19 and FY20 CDBG annual action plan per HUD guidelines to allocate funds to create micro business stabilization fund. And I'll take any questions that you may have.
Okay, first of all, is there a motion to adopt that resolution?
This is Commissioner Fuller. I'll make that motion.
All right, is there
Me.
who seconded?
Lee.
Oh, Commissioner.
Dilma D. Lee.
Okay. Been moved by Commissioner Fuller, seconded by Commissioner Leak. Any discussion?
Yes, Mr. Chairman. This is Commissioner Rodriguez McDowell, and I was just wondering if Mr. Tibbs could, just for public awareness, go over the last point again about excluding Charlotte and Mint Hill. Could you just explain that again?
Sure. Like I said, the city of Charlotte has their own program. So the county's CDBG program area consists of towns that have joined in our program, and those are all the towns with the exception of Mint Hill that has not joined the county's program, and the unincorporated areas. So that means that those funds obviously are not available to the city of Charlotte's businesses, but only to the towns with the exception of Mint Hill and unincorporated areas.
So, Timothy, let me ask one question. And it goes back to the discussion that we had earlier. Is it where the business owner lives, or is it where the business is actually located?
It is where the business own. It's the HUD wants to look at the. Let me go to that. 1 second. This is based on see where they live.
Where the business is located.
I'm sorry. Well, see, I guess that's a. They must live in our CDBG program area. So it's based on where they are, but we're asking for their they have to certify that they live in the program area, and depending on what they're asking for, then they have to provide whether they pay rent or mortgage, depending on the assistance they're asking.
And the reason I'm asking this question is, as you have already explained, if you live within the city limits of Charlotte, you have to apply for the city's program and not the county's program. I want to make sure that people understand that.
That's correct.
Okay. Any additional questions?
Yeah, Mr. Chairman, I have one additional one, if I may.
Okay.
So does the city of Charlotte, or are they going to have a micro business stabilization fund with their own money, like ours?
Commissioner Fuller, they had and I apologize, I don't have the full answer to that, and others who might. They had their work meeting last night, and as I understand it, they have plans to model kind of a micro business fund, and hopefully that will happen so that there will be a City of Charlotte companion piece. But I'd have to find out exactly what their plans are and the timeline, which is not going to probably be the same as ours.
Right. And so, I'm going to support this. In fact, this is a lot easier for me to support it. I do want to, again, reiterate the notion of, and maybe it won't happen as much because of where the program area is, but I want to re-emphasize this whole double dipping kind of thing, because I really do, it's really important to me that we help as many people as we can and spread money as far as we can. But with that concern, I'm going to support this motion.
Okay, so at this time we'll move to a vote. Commissioner Cotham. Commissioner Cotham. Commissioner Ford.
Mr. Chairman, can you hear me?
I can now.
All right. Okay. Thank you. Thank you. Can I ask a question?
Well, we're at the stage of voting now.
It's just that on our agenda, it just said we were going to receive information. It didn't say we were going to vote.
Commissioner Cotham, we amended the agenda at the beginning of the meeting.
Oh, okay. All right. Well, thank you. All right. I'm sorry. I forgot that. I'll vote to support this. Aye.
Okay. Commissioner Fuller.
Aye.
Commissioner Harden.
Aye.
Commissioner Jarrell.
Yes.
Commissioner Leak.
Yes.
Commissioner Powell.
Yes.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Scarborough.
Aye.
And the chair votes aye. Okay. Thank you. We have, we're moving to.
I have one more item.
Yes, one more item.
Thank you, Mr. Chairman. We did want to bring forward to the board a financial status update. As you know, we've told you because of COVID-19, we do have some concerns about revenues for the rest of this fiscal year, as well as for fiscal year 21. So I've asked Sarah Cunningham to prepare a financial forecast for you so you can get level set on where we think we are going to be from a revenue perspective, and we start to prepare the budget for fiscal year 21. So with that, I will turn it over to Sarah.
And before Sarah begins, let me just remind my colleagues that this is just for information only, and there will be several more reports like this in the future. So what you hear tonight will be different than what you hear the next time. Information only. Thank you, Sarah.
Thank you, Chair Dunlap, Commissioners, and County Manager Diorio. Good evening. Tonight, as County Manager Diorio outlined, I'll provide an update on our financial status and forecast in light of the impacts of COVID-19. First, we'll provide some context around the economic impacts of COVID-19, and then we'll turn to the implications for our fiscal year 2020 performance and anticipated fiscal year 2021 revenues forecast. Next slide, please. The economic impact of COVID-19 is fluid and unlike anything we've seen in recent decades. Moreover, the situation is rapidly evolving. The Wall Street Journal reports 8 out of 10 counties nationwide have some form of lockdown, impacting over a quarter of the economy as measured by daily output declines from the beginning of March. Accordingly, we are expecting a sharp decline in the economy this quarter. We expect it will be roughly a year for us to recover. Our current forecast assumes actions to flatten the curve of new COVID-19 cases are effective. We anticipate the negative impacts on revenues will last through the first half of fiscal year 2021. Next slide, please. Now, unlike the Great Recession, where there was a demand-side shock and a loss of income resulted in people spending less, this is a supply-side shock, where closing businesses are negatively impacting consumers. The stay-at-home order protects public health, that has economic consequences for retail sales and all industries to varying degrees. Fast food restaurants like Wendy's report that same-store sales are down 50%. Airlines are reporting that the impact on air travel could be double that of 9/11. For example, American Airlines flights through 3 New York City airports were down to about 13 per day from over 300 at this time last year. Unemployment could top 32%, according to the St. Louis Federal Reserve. Jobless claims for the last 2 weeks of March nationwide were about 10 million. 2/3 of that, or 6.6 million, were in the last week of March. Many small businesses are likely to fail. Federal stimulus and other support programs, like the Small Business Emergency Stabilization Loan Fund, will help. However, some small businesses, especially those that are highly leveraged, may not reopen. A survey by LendingTree found that 71% of small businesses feared they may not fully recover from COVID-19 losses. Hotels in the earliest impacted markets saw declines of 40 percentage points in occupancy. Next slide, please. Now, the good news is that the county is entering this crisis from a strong fiscal position. In addition to a healthy fund balance, the county has a strong debt profile with about $1.5 billion outstanding. This is compared to over $2.2 billion that was outstanding at the Great Recession. This means our debt service obligations are lower, giving us greater flexibility. The county has started the year with about $259 million in reserves, which provides us options to continue critical programs and services and avoid the steep cuts from the Great Recession as we face revenue impacts. The county has had strong performance through the end of February on key county revenue streams, which are tracking at or better than previous forecasts prior to COVID. Next slide, please. Now, digging a little bit deeper into our primary county fund revenue streams, property tax has been performing well year to date, with natural growth and discovery serving to buffer some of the COVID-19 impacts. The county has already collected over 98% of the property tax levy as of the end of March. With COVID-19, we're expecting a dip in the assessed values for registered motor vehicles, with fewer new car purchases and depreciation on our existing assessed values for motor vehicles. We anticipate the largest impact in property tax will be from lower collections of delinquent taxes and interest, as most of these receivables tend to be for smaller taxpayers who may have less ability to pay. Next slide, please. On the sales tax side, the county has seen strong sales tax collections through December, up 8.7% year over year to date. Keeping in mind that the 3-month lag in sales tax collections, that gives us another couple months of receipts before we feel the COVID impact. With anticipated impacts to travel, tourism, events, restaurants, and services, however, we expect sales taxes will be hit hard in the last quarter of fiscal year 2020, with revenues about 23% below the same time last year. The negative sales tax impacts will continue into the first half of fiscal year 2021, before returning to normal according to our current projections. Next slide, please. Investment income will also decline due to recent Fed actions to lower rates. Now, our investment income for fiscal year 2020 is expected to be stable. Higher interest rates at the beginning of this fiscal year and smart investments over the last several weeks will help support returns in line with our projections at the time of the budget retreat. However, as we start to reinvest funds in fiscal year 2021, we expect our returns are going to fall significantly. Next slide, please. Now, another aspect of COVID-19 are the costs of the actions the county is taking to protect public health. This includes investments to continue operations and move more county services to a virtual environment, extra cleaning and supplies. It includes the lodging that we provided, including food, laundry, and security. Another $1.3 million provided to the helpsharmac.org COVID-19 response. Altogether, we estimate we've spent about almost $5 million. And if you add the $5 million for the Small Business Emergency Stabilization Fund, that's about $10 million in COVID-related spending so far. Next slide, please. Now, for our financial status and forecast, we wanted to look to a range of scenarios given the uncertain environment. We evaluated first a base case and then modeled worst case and best case scenarios well. Just to walk you through how we approach this analysis for our major county revenue streams. For property tax, we looked at the property tax impacts on prior year taxes, interest, and registered motor vehicles values. We estimate in our base case a $284 million loss in value over fiscal years 20 and 21 due to COVID for our base case. When we look to our worst case scenario, we're expecting a greater negative impact on motor vehicle assessed values up to $325 million. In our best case, we expect a lower impact over the same time period for motor vehicle assessed values of about $243 million. Now, we're assuming the same impact on delinquent tax and interest collections in all three cases for property tax. On sales tax, our base case expects a hard hit in the fourth quarter of fiscal year 20, with 6 months of impact and a slow recovery. The worst case assumes the negative impact stretches over 9 months, and the best case assumes a shorter negative impact. Looking to investment income, our scenario in the base case is that for fiscal year 2021, we'll earn an average of 35 basis point on reinvested funds. Our worst case scenario assumes a 15 basis point return, and our best case assumes the market returns quickly, and we have 75 basis points returns on reinvested funds. Next slide, please. Now this slide shows our fiscal year 2019 budget, our fiscal year 20 adopted budget estimates, and the 3 COVID scenarios for revenues for fiscal year 20 so you can see them all together. Our base case reflects property tax of about $899 million. This is showing some growth over the fiscal year 20 adopted budget. This is due to real property growth, post-Bureau Equalization Review appeals, and some discoveries that are making up for the negative impacts on prior year taxes and registered motor vehicles in 2020. For sales tax, we're projecting about $195 million. That's $13 million below our fiscal year 20 adopted budget, or about a 6.25% loss. For reference, our worst case scenario estimates a 10% loss relative to the fiscal year 20 adopted budget. Investment income is expected to hold steady for fiscal year 20 in all 3 scenarios at about $19.1 million. This is above our fiscal year 20 adopted budget due to those Fed actions early in the fiscal year that helped increase our interest rate returns. Other revenues reflect a $5.4 million decline. This is driven by room occupancy and vehicle rental decline in 2020. On net, our county revenues for fiscal year 20 are estimated to be about $2.5 million over budget from the fiscal year 20 adopted budget, with the property tax and investment income gains overcoming the sales tax losses due to COVID-19. Next slide, please. Looking at the fiscal year 20 on the expenditure side, we currently expect to spend about $1.4 billion for 98% of the operating budget. This includes the approximate $10 million of COVID-19 related expenses we showed earlier. We anticipate some additional expenses as well due to COVID, including special assignment extended duty pay, and are tracking these closely. Next slide, please. Looking to the debt service fund, we expect about a $2.4 million loss on sales taxes relative to the adopted budget for fiscal year 20. Next slide, please. On the expenditure side, we do not forecast any COVID-related impacts to the fiscal year 20 debt service fund expenditures. The updates that you see here are only for actual debt service and bond issuance costs, which are lower than the adopted budget due to the size and timing of our debt sale. Next slide, please. Now, looking at the COVID impacts for fiscal year 20, we're expecting to use about $38.4 million of general fund balance. The debt service fund is expected to increase about $11.8 million, leading to a net use of about $26.6 million of combined fund balance due to COVID. Now, this reflects both the revenue impacts and the expenses that we showed earlier. Now, it's important to note, not all of the fund balance is available for use. As noted earlier, at the start of the fiscal year, we had about $259 million in unassigned funds available for reserves. Next slide, please. The COVID-19 impacts are forecast to be felt well into fiscal year 21. We expect property tax revenues will grow, albeit at a slower growth than had been previously anticipated for fiscal year 21. We are also projecting a slightly lower collection rate for fiscal year 21 property taxes, in addition to the delinquent tax and registered motor vehicle impacts we discussed earlier. Sales taxes are expected to be about $7.5 million below the fiscal year 20 adopted budget for fiscal year 2021. This reflects a small growth over our expected fiscal year 20 COVID base case, but is roughly flat, where most of the growth is going to be happening at the end of the fiscal year for 21 as we enter the recovery phase. Investment income is expected to fall 54% in our base case, with a 35 basis point returns. County funds overall are expected to be about $1,120.7 million. or about 10 million or 1% over our fiscal year adopted budget. Next slide, please. Looking at the debt service fund side, we expect revenues to be relatively flat compared to fiscal year 20. Next slide. Overall, debt service fund revenues, are we on the next slide, please? Thank you. Overall, we expect about 10.3 million in growth in county funds for fiscal year 2021. Keeping in mind, these county funds is what we have available to be able to invest and increase costs for current services and any new investments. This 10.3 million compares to our estimated 46.4 million or 4% growth rate we had been projecting prior to COVID impacts for fiscal year 2021. Next slide, please. I also want to take some time to point out that there are still several things that are not known. While there are funds that are available to local governments from the federal stimulus and state programs, the timing and amount of these funds that we might be able to achieve are not clear. The county is going to do everything it needs to try to maximize recovery from FEMA and other resources, and departments are already tracking all COVID-related costs, including staff time for reimbursement. However, there's still some guidance forthcoming. FEMA funding is considered last resort, so we will need to pursue all options available. The economic impacts of COVID are also not known. The actual impacts could fall outside the scenarios we have forecast, either worse than the worst case or better than the best case. We'll continue to closely monitor and provide updates. And with that, happy to take any questions.
Okay, are there any questions, keeping in mind those statistics, that data changes?
Yes. Are you going in order or?
Okay, let me start with Commissioner Cotham.
Oh, thank you, Mr. Chairman. No, I don't have any questions. I want to study this, and I'll just email Sarah if I have any questions. But thank you for asking.
Commissioner Fuller.
Yes, thank you, Mr. Chairman. I had just one question. So there was an article in the Observer that criticized the county for not using what they said was about $359 million in reserves to help lessen the impact of COVID-19. Can you comment on that? Is there $359 million of reserves that we somehow have failed to activate, or can you respond to that?
I will defer to the county manager, but I can point out that that $359 million included both city reserves and county reserves.
Okay.
And so it is the case that we have already been spending funds on mitigating COVID, including the lodging, $1.3 million for helpsharmac.org and the like. But to the extent that they're saying that there's no actions that's been taken, I'm happy to defer to the county manager.
Thank you, Sarah. Here's what I would say about that is that, we are going to need those reserves to maintain current service levels for fiscal year 21. I think it was premature in that article to make the statement that we haven't used our reserves because we hadn't needed to use those reserves because COVID just happened. But when we put the budget together for 2021, we are going to be using reserves for operating expenses, which is normally what we don't do. But we'll be doing that to make sure that we can keep all of our employees employed as well as maintain current service levels.
All right. Thank you for that explanation. Thank you, Mr. Chairman.
Thank you, Commissioner Scarborough.
No questions.
All right.
I'm good.
Okay. Thank you, Commissioner Harden.
Yes, thank you, Chairman. So, Sarah, I know that we have a minimum a minimum general fund policy of 28% of our general fund. We have a fund balance policy that allocates as a bar 28% of our general fund revenues. Is that correct?
It's a combined balance, but yeah. So basically, the prior year general fund revenues, we want to maintain a combined fund balance of at least 28% combined. Just to clarify, to the county manager's point, our policy also allows us to dip into those reserves, provided that we replenish for emergency situations if needed to cover operating expenses.
So on a report that you gave the audit committee on March 4th or March 6th, maybe of this year, you said that, for this year, the 28% general fund revenue was 362, the $362 million. That was that would be our 28%. Does that sound right?
I'm pulling it up right now just so I have the exact number, but basically in that, that is the 362 million was the 28% of general fund revenue that we applied for the test going into fiscal year 2020.
Right. So if you look at that 705 on slide 15 and compare it to that 362, that's our 28% number.
We can't do that kind of a direct comparison. You would have to go back and first take out, looking at the combined fund balance, you have to take out the amount that's restricted by state statute. So that would knock out about $145 million, just if we took the numbers from last year. We also have to pull back the funds that have committed, that already committed or appropriated by the Board of County Commissioners for specific purposes. That was another 120 million. When you look at I guess it's not an apples to apples comparison. You can't look at the 705 and take away the 362 because we have to look at the fact that the debt service fund is already committed for debt service and to meet our PAYGO obligations on our capital fund.
And then I'm just looking on that slide. You said our appropriated commitments were 120, but on this slide it shows $81 million. We're not back. Are we backing off on our commitments that we've made for our fund balance?
No, they're just at two different points in time. So the appropriated fund balance that you see here in slide 15 reflect the 81.7 million that we passed in last year's operating budget for fiscal year 2020. 120 million include additional commitments that were made by the Board of County Commissioners and additional appropriations. So it's just two different measures of appropriated fund balance at different points in time.
Okay, that's helpful. Thank you. So I guess my question is, would you consider what we're going through a rainy day?
Yes.
And so I think my constituents would consider it a rainy day too. And so I'm glad to hear you say that, because I hear what the county manager is saying is that we're going to need to dip into those reserves to move forward. I also think that we don't know yet, and I thought your last slide was a good one, what our community is going to ask us to do or how deep this situation is before us. And so and we do have significant funding over our reserved and allocated fund balance. You would agree with that?
I would say that we're starting from a healthy position, but we also have to keep in mind, as County Manager DiOrio pointed out, that as we go into fiscal year 21, having only a 1% estimated growth rate means that we're going to have to be dipping into that reserve to be able just to keep up current services. So that's part of, I believe, what the budget discussion is going to be going forward.
Thank you. No further questions, Chairman.
Commissioner Jarrell.
Good, Mr. Chairman.
All right, Commissioner Leak. Commissioner Powell.
Very good. I'm sorry.
Commissioner Lee?
I said very good. No question.
Okay, Commissioner Powell.
I just have one question for the future. Sarah, could you give us more detail on COVID-related expenses? And maybe you could just email that to us.
Happy to follow up with that, yes.
Thank you. That's all.
All right, Commissioner Scarborough. Commissioner Susan McDowell.
Thank you, Mr. Chairman. I do have 3 questions. First of all, on slide number 9, regarding the expenses for COVID so far, can you just help me understand what is the lodging? Is that the motels that we are using for homeless folks, or what is that lodging?
That's exactly right. Those are the hotels for the homeless. It also includes the security costs and the food costs and laundry costs associated with providing that assistance.
Okay, terrific. Thank you. And is that like thus far, or is that like a 90-day period, or like how long is that going to go for?
It's a great question. It's a combination. So it includes the 90-day period of the lease costs. There are some elements that are more operating, and those invoices are still coming in.
Okay, thank you. And then on slide 12, can you just help me out with when you're looking at Health and Human Services, why does the number go down with COVID for Health and Human Services? Like from the FY20 to the, sorry, I interrupted you.
Oh, no, I interrupted you. I apologize. I'll let you finish your question.
Well, my question is, it says the FY19 actual was 262.6, and then the FY20 budget is 271.3, but then revised with COVID. How does it go down? I would have expected it to go up.
So for the fiscal year 20 adopted budget, we were assuming full expenditure of everything that was appropriated. When we look to the revised for COVID-19, that accounts for things like vacancies, slower spend on priorities that haven't yet been achieved. And typically it will be something a little bit less than 100% as we go through. But to your point, that is one of the areas we're closely monitoring for the other potential COVID costs that we expect to come. For example, the special assignment pay or extended duty pay.
Okay, I'm sorry, maybe I just didn't get it, but that makes it sound like the cost would go up.
So we are monitoring it. What you see there in the estimate for 268.9 million, that reflects the fact that some of the positions we thought that would have been filled in the 20 adopted budget haven't yet been filled.
Oh.
So there's some expenses that are lower because we haven't yet filled certain positions. There may be contracts that haven't been executed yet. Mm-hmm. And so it's accounting for all of that. That's why we're projecting something slightly lower than the 271.3 million from the adopted budget.
Mm-hmm. Okay. And then just finally, I just want to say that as I looked at this and sort of studied it, it kind of, and I know you guys said you're going to come back with more numbers, but I was really surprised. And I kind of want to know, should we be bracing ourselves for a shock to our system? I mean, because when I look at your worst case scenario, it just doesn't look that bad compared to the base case, or, when I'm looking at it, I'm going, gosh, I thought this was going to be, way more devastating to us. And not that I want it to be. I'm thankful. I really wanted to say, first of all, that I'm thankful for our current reserves and our healthy, standing that we have right now financially, because I was reading about Cincinnati and how, they had to lay off 1,700 public health workers recently. And at this time, gosh, can you just imagine if we had to lay off public health employees? So I'm really thankful that we're in a good financial position, but I'm also kind of surprised. And I wonder if you're going to be preparing us at some point for, austerity, or if you're bracing for worse numbers than this when you come to us next time.
Yeah, well, I would say that even just looking at this, it is the worst numbers. If you're looking at what it takes to sustain current services we would need a growth rate in revenues for county revenues greater than 1% to continue on the priorities and current services at the same levels that we did in the fiscal year 20 budget. So what we're projecting under these cases is that we are going to have to be, it's going to be a very lean budget. And to County Manager Diorio's point, we're going to need to dip into reserves to keep up our current services going into fiscal year 21. To your point on could it be worse, I think that's one of the big unknowns we want to stay on top of. When we look at the various reports, we've been working with our economists, we have been working with other local governments in the Big Ten, asking everybody else, and what are you looking at? We've looked to the Wall Street Journal, McKinsey, KPMG, all of these different economic forecasts. And I think our forecast is in line with, I would say, a good number of the analyses that we've looked at in terms of it being a very hard hit for the fourth quarter, a couple more quarters of hardship, and then a slow recovery curve, something we call a U-shaped curve. There could be other events that make that a faster recovery. There could be things that make it more difficult and a longer decline in revenues. I think that's why we want to stay on top of it and continue bringing you all updates.
Okay, thank you very much, Mr. Chairman. That's all my questions.
Okay, let me again remind you that you're going to be seeing these numbers change over the next couple of months, because what you really looked at was a combination of a lot of things. You got the unencumbered funds. Those are the funds that we really already have commitments to that we may not have paid for. So if we bought something in the year, but we're not due to be billed till next year, you got that. Then that's offset by the amount of money that you don't spend because you have so many vacancies over the course of a year. So you have some vacancies that were for 3 months. You got some vacancies that went unfilled for the whole year. So you got monies there. There are just so many things to take into consideration that this is just for information. If, for example, we only generate $10 million in additional revenue for next year, we know just to maintain CMS costs more than $10 million just to do next year what we did this year. And the same thing is true with the county. So there will be an expenditure of funds from the reserve. In addition to that, we still can't be sure that we're not going to have a recession. And so that's why I don't want to get too involved with looking at these numbers, because these numbers will change every time you look at them. And so what we're hoping is that there will be sufficient offset from funds not spent to mitigate the amount of funds that we might have to dip into our reserve to cover. So thank you, Sarah, County Manager, for that update. Okay.
Thank you, Mr. Chairman. That concludes my manager's report.
All right, thank you. So we had an item added to our agenda, which was reports from commissioners. Commissioner Susan Rodriguez McDowell, since you added that item.
Thank you, Mr. Chairman. I appreciate the opportunity to raise this as an item on our agenda. I just know that all of us have been receiving many letters and a lot of communication from our residents. And I think that what I was really hoping for was a time to be able to speak to people as we are being looked to for leadership. You know, I really want our community to see us, to hear us, to know that we are working on their behalf, and to know that we're trying to bring their concerns here to our meeting, and not just have the concerns coming to us from staff. I wanted to be able to make sure that we were raising the other concerns that we were hearing in the community. So when I heard you earlier say that we would be meeting in 2 weeks, and I would really like to bring up for discussion the idea of meeting weekly. And I understand that it takes a lot of work for staff to pull off these meetings. But I think at a time of emergency and crisis, it is really important that the community sees its leaders meeting and working on the issues. I think what they want from us is transparency, and they would like visibility into the process of our decision making. And I think it's really important that we give that to them, not just in the form of statistics, but into visibility into the process. And that's why I think it's important for us to be getting updates on a weekly basis in public. And so I would like to raise that. I would like to actually make a motion around that and see if I can get some support from my colleagues.
Chairman, I'd like to second that motion.
Okay. It's been moved by Susan Rodriguez McDowell that we meet weekly, seconded by Commissioner Harding. Discussion.
Mr. Chairman, Leak here.
Yes, Commissioner Lee.
But they're going to be given issues or issues that is in the process of this crisis. I'm asking if we're going to meet once a week.
So Commissioner Rodriguez McDowell, can you share with Commissioner Leak what will be the subject matter each week?
Yes, I think that the subject matter would be bringing to the surface what our constituents are asking from us, and also receiving updates and receiving information publicly about what's going to be happening going forward. So if our model is correct, that we haven't hit our peak yet, I think it's really important that the community gets briefings, and that we get briefings, and we're able to come to ask questions, and we're able to bring the visibility to the process. And so it seems like a minimum of once a week during this emergency period, we should be able to be a part of the process in that way.
So are you suggesting then that excuse me, Ms. Lee.
Thank you. I'm sorry.
I was
going to say thank you, Susan, for answering that for me. And that's one of the issues I've been trying to inject for a long time, because it says county commissioners meeting and not everybody else is meeting. So thank you for that recommendation, and I second your motion.
Commissioner Dunlap and board members, I must remind you that in any meeting, you must meet the open meetings laws. I understand that there has been a meeting schedule that has been published for the board. So in order to have additional meetings, you'd have to call them either special meetings, which would mean you'd have to have a special notice provided, because the board's calendar has already been posted. So you create all kinds of complications to meet weekly, to craft an agenda, and then to have it prepared. And now, since we cannot meet in person, you would have to always have this type of technology, which really consumes an inordinate amount of time. And I understand what you're saying, Commissioner Susan Rodriguez McDowell. However, there are some legal implications you need to seriously consider if you're going to go down this path.
So thank you.
We don't have resources to be able to pull that off. Is that what you're?
This is the clerk. Can I ask a question? You have budget public policy meetings scheduled for next week at 2:30 to 5. Would that fulfill the motion that you're proposing? Because that is on the schedule, and we are planning to have a meeting next week.
Oh, fantastic. I thought the chairman said we weren't going to meet for 2 weeks. And so that's why I was thinking it seems like not enough I thought all of our other meetings were sort of on hold for now. And so I'm really pleased to hear that next week's meeting is on.
Okay, so let me clarify. When I said that, I was thinking about our regularly scheduled meeting. because every other meeting is a public policy meeting. And so, yes, we do have a public policy meeting scheduled for next week.
Okay.
Mr. Chairman, can I make a friendly amendment to Susan Rodriguez McDowell's proposal?
Okay, before you do that, I want to make sure that you clearly heard what the attorney said.
Yeah, I did. So my only request is that at the public policy meeting that we get COVID updates, that's a regular part of the agenda. So as long as those updates and we have the opportunity to speak about and raise questions about what's going on, then I'm very comfortable using the public policy format.
Okay, well then, if that's excuse me.
I'm sorry.
If that's the case, we don't need to do anything with the agenda because we have gotten an update at every meeting, irrespective of whether it's a public policy meeting or a regularly scheduled meeting.
Right.
That's right. Then I'll withdraw my motion because I didn't think that was the case. I thought they had canceled our other meetings. So I'm really glad to hear that.
Okay. Given that this item on the agenda is commissioners' opportunity to share, is there anything else that need to be shared?
Yes. Mr. Chairman, this is Susan Rodriguez McDowell again, and I was hoping that there would be a time where we would just be able to speak to what we are hearing from our community, and I wanted to raise the homeless situation that I'm getting a lot of calls about, and I just wanted to acknowledge it in our public meeting that we are working on this behind the scenes, that we are continuing to work with our partners, and I've been speaking with a number of them, and I think that sometimes when the community doesn't have visibility to that, they might think that nothing is happening, and so I just wanted to raise that we are working with our partners to try to meet that need. And I just really want to make sure that we focus on our at-risk homeless. So we know that we can't solve homelessness, especially in the middle of a global pandemic. But what I am hoping that we can do is address our homeless that are at high risk, meaning folks who are over 60, 65, the CDC recommendations, people who are HIV positive, people with asthma. That's something that I'm really interested to see if we can make a dent in that. So that was one issue that I wanted to raise as part of a commissioner request. I also wanted to see if we could raise putting the Spanish language option on our 311 call center. Actually, any of our hotlines or information and reporting lines, if we can have a Spanish language option. I would like to know if we can talk about that. I also wanted to raise, I wanted to understand when the awareness campaigns are going to begin that Gibby talked about. And one last thing I wanted to say is that I just really wanted to reiterate to the community that as commissioners, I know that all of us really understand how much pain that people are going through at this time. But I really also wanted to say that just because some people think that what they do is more important than other people, like, for instance, having a volleyball match or an abortion protest, you shouldn't give you the license to subject the rest of the community to greater risk. So I just really want people to hear me say that I hope that people will respect the guidelines that we have in place for the stay-at-home order. And I hope that we are able to get more enforcement for those. So thank you for just having the opportunity to have a few minutes to express my concerns.
Okay, and I appreciate that. But let me share this, and I hope all of us will take this in the right spirit. When we wait until we get a meeting to share those concerns, we have lost 2 weeks when we could have had those concerns being addressed. Those things could be shared with the county manager at any time. And so if you share the concern when you have the concern, she may have had a response tonight for those concerns because she would have had 2 weeks to work on it.
We have been conversing about that with different staff members, but I wanted the community to hear it.
Okay. Any other concerns?
This is Commissioner Powell. And I wanted to ask Dina for some clarity on the parks, greenways, and golf courses. So can you say again which ones the gates will be closed?
It's really, all the gates.
Can we finish the agenda first? Can we finish our agenda first?
Commissioner Lee, this is on the agenda. We added it to the agenda at the beginning of the meeting.
I'm always wrong, right, George?
Well, in this case, you are.
I don't feel so.
Okay.
So Dina, for every gate?
Yeah, every gate is going to be closed. I think, you've heard the same feedback that we've been hearing about the crowds in the parks, particularly the larger parks. And what is that a lot of people drive to those parks to be able to access them. And we want to make those available, but we really want to try to do our best to disperse the crowd. So all the larger parks that have gates, those gates will be closed. And it really walk-in only.
Okay, and can we provide a list for, on our Mecklenburg County Twitter so people can see the list?
Absolutely.
And then the other thing, and I have been communicating with staff, but I think it's important to lift this up now because I don't know where the funding would come from, whether we should make a formal request to Foundation for the Carolinas or if this is something that the county could do. But we are getting a lot of phone calls from the homeless advocates about, some people understand that we can't solve it. And how can we help get some hand washing stations and shower stations? I looked it up online to see different kinds of showers that they have for military. And can we make a formal request to Foundation for the Carolinas, or is this something that we could do? Because I think the more opportunities they have for hygiene, the better. And also, maybe some portable laundry, or I'm just bringing up ideas, but what do you think, Dina?
Well, let us check into those two things that you mentioned. One of the things that we did do is we did put Porta Johns in Uptown because we know the library closed and other places closed that the homeless used for those purposes. So we put Porta Johns and hand washing stations throughout Uptown and made those available. As I indicated earlier in my report to you, that the city is actually going to use their emergency services grant to provide hotel space for families and individuals that are medically fragile. And those hotels will be made available to those folks until the end of December. So that's what we're doing as well. And as you know, we've created hotel space to provide additional social distancing so we don't have as many people in the shelters. So we have done a lot about that. There has been a tremendous amount of talk about these tent encampments that we were getting a lot of conversations about around that. We did get a lot of feedback from law enforcement about a lot of the challenges that presents. So that was not a strategy that we wanted to go forward with. But in terms of portable showers and laundry, we can certainly investigate that. But I certainly don't want the community to think that we have not been evaluating what we can do for the homeless. We talk about it all the time and just trying to find the best strategies that we can to support them during this time. So it is a conversation that we're absolutely having. But thank you for those questions.
And I appreciate you, answering this. And I think it's real important for the community to hear because, we get attacked in the emails because they really care so deeply about helping this population and stopping the spread of the coronavirus. So you know, the more we can help with hygiene and the more that people know that we are doing things, the better. And that's all that I have. Thank you.
Mr. Chairman, I'd like to add some comments, please.
Okay, Commissioner Jarrell.
Thank you, Mr. Chairman. So a couple points. I want to say thank you to Commissioner Rodriguez-McDowell, number one, for lifting this up and allowing this type of discussion to take place. I think sometimes there's a propensity for folks to believe that, you know, when people are going outside of what tradition has called for, or a little outside the box at times, that it is a shot against staff or certain individuals, which I don't believe it is by any stretch of the imagination. I think everybody on this call has the utmost respect for staff, and certainly for the county manager and for the work that she's done, the tireless amount of hours that she's put in, and her uncontested intellect by far. And but with that being said, I do think it's important for us to lift up certain things. When it comes to our form of government, you know, this is our form as elected to address the public. This is where we do it. And I think I have seen plenty of emails behind the scenes where people have raised questions, concerns, and different things of that nature. But I do that, you know, this is a forum where we have to provide the level of confidence to our constituents and to the public that as elected, we are raising certain concerns as well. And this is the appropriate forum to address many of those items. And so I want to say thank you to Commissioner Rodriguez-McDowell for bringing that up, because I do believe that there should be probably a little bit more engagement around what we are hearing from our constituents. What are we hearing out here on what are the blind spots that, you know, staff may not be visible to? I think could be more direction on or engagement on how we can add value as electeds. And I think we can toe that line without getting in the way of what staff has to do, and also being considerate around the challenges that they're experiencing. I think the goal is supportive as possible. And I think the collaborative effort between electeds and staff, you know, just adds a tremendous amount of value to the community if we leverage it properly. So I hope everybody takes that in the spirit in which it's meant. The other thing, since we do have this forum, I do want to raise, and I think Gibby's probably still on the line, and it's not necessarily for you to address, but I'm a little concerned about our Latino population, whether I look at our statistics here locally or if I look at the statewide statistics. I think there has to be a tremendous amount of engagement in that particular community around what they're seeing about fears around ICE and different of that nature, to make sure that we're not receiving false positives and thinking that that's a community that is not impacted. Because typically when we look at those health outcomes, African Americans and Latinos are usually neck and neck when it comes to disparity. And there's a huge variance between those two groups, which I get is striking to me. So I would love for us to be able to address that. And then the final thing that I would ask the county manager to consider, I think the briefings with she and Gibby have been excellent as far as the information that's being told and what they've been doing. I also think it may add some value if we leverage some of the community leaders, not to talk, but to stand behind you and show that, you know, they are behind 100%. We have some pastors that are very visible, and for the members of the congregation would make them listen to us, I believe, if they see them, would listen to us a lot more, and other community leaders out there. So I would hope that there's a way to make the briefings more expansive, again, not for people to talk or talk policy or public health, because we have people to do that, but just visibility purposes. I think there are people that definitely have a tremendous amount of credibility. When people see them, they really wake up, look up, and they'll stop what they're doing to ensure that the message is getting through. Thank you for the time and allowing me to say that, Mr. Chairman.
Okay.
Thank you, Commissioner Drill. Let me just say one thing. I did let Gibby go after the COVID-19 briefing to get a little bit of rest. So she's not on the call any longer, but I will go back and have a conversation with her about the Latino population. And I thank you for your suggestion about having additional people stand with us at the briefings, and we'll certainly check that out. So thank you.
Thank you.
All right, Mr. Chairman, may I just a minute?
Yeah, yes, sir.
I thank you for, and thank everybody for this space. I think it's really important. We watch nationally as, people like the governor, our governor, Cooper, and in the media more, Governor Cuomo of New York and others across the country. We see them giving briefings regularly, and it is a form of responsiveness of elected leaders to the people. And we have a different form of government here where our county manager and our professional staff do the majority of the work. And so it is fit that they are the voices that are speaking on these topics that we need to have expert and accurate information about in this time of pandemic. But I don't think that takes away from our responsibility also to be visible to the public. And I think in a meeting form is the most logical way for that to happen. So I'm glad that we had the discussion about having meetings, and particularly since they're virtual, we should have less difficulty doing that than gathering everybody physically. I also think it's important for us to have these discussions publicly. Getting to the result is good, and we want to get to the right results, and we want to be effective. But what I've learned in my service and in public life is that people also value process. They value whether you are making appropriate balances of the public interest. And people don't know that you're doing that unless they see you doing it, unless they actually observe you making the tough choices about going this way versus that, issuing an order, stay-at-home order like we did, making amendments to it. People need to see that we are doing this work. And so I think that's an important reason for us to have this time in our meeting, and that we have meetings so that people can see what it is that their government is doing for them. And so I just am so grateful to everybody on this board who has a healthy and appropriate respect for the professional staff that we have hired, the county manager that we have hired, our most important hire, one of only 4 that we make, that we have reposed in her the trust and confidence to speak on our behalf in times like these. I think that is so critical that we continue to support her and her staff. And in addition to that, that we provide appropriate feedback from the community, that we fulfill our role to provide different perspectives on actions that we take on the public's behalf. So I'm just so grateful for this meeting and the notion that we are going to meet again. I think this is good for us. It's good for the public to see us doing this work and knowing that we do care. You can tell me that you care, but I sure like to see it. I'd be more convinced when I see that you care. So thank you, Mr. Chairman.
All right, anyone else?
Mr. Chairman, I'd like to bring an issue to the forefront.
Okay.
Issue that I'm hearing about. I'm hearing from constituents who have been trying to apply for unemployment claims. Just the difficulty with the system. And then the other thing I want to bring up is that apparently, while we have a high level of people who are applying for unemployment, it doesn't mean that their application is being accepted. In other words, applications are being denied. And my understanding is that North Carolina has a low rates of eligibility. And so I just want us to pay attention to that in Mecklenburg County. I want to know how many people are applying for unemployment claims, and then how many people are being denied those claims, and where the loopholes are, because I think we need to pay attention to that, because if they're not able to access unemployment claims, I think that pretty quickly we're going to see some real problems emerge. And so anyway, I just wanted to share that with the group, that my understanding is, like, just in North Carolina alone, 500,000 people have applied, but only 100,000 people have actually been provided with the benefits. And so, I mean, that's a 20% rate. So that's okay. But I mean, I just think we need to pay attention to the number of people who apply and then the number of people who are actually eligible for those benefits. So I just want to share that with the group. And I'm hopeful that that's something that we can ask the county manager. I sent this to her in questions to pay attention to, because I think it's, as I said, I think it's really problematic. So that's my comment.
So thank you, Commissioner Hart. And as you know, I mean, this unemployment is run at the state level. So we've got your questions, and we'll see how much data we can actually pull down from the state and report back on that. But I'm not sure how much visibility we have into that data, but we'll check it out.
Thank you. And knowing the answer to that question, I also think I've been on the phone a lot with our legislators in Raleigh. I think it helps us advocate for changes at the state level too, if we know that the systems that they're providing that they're, you know, big loopholes, and they get that information from us, because we're the boots on the ground. So thank you for that, County Manager.
Okay, anyone else? Okay, well, I guess I'll make the last comment in this particular item. I've heard some really good ideas, and I think we can do better. We can improve on what we're doing now. But I think it was a good idea to have this opportunity to air those concerns, which is why I supported putting it on the agenda. I do want to bring your attention to one thing, and that is the super spreaders in our community. These are the groups and organizations that are spreading the virus in large numbers. This past week, I got 2 phone calls. One about a church where the members believed the pastor had the virus and spread it among the congregation, but said in front of the congregation that he was healed. And the thing that made this church member share what was going on was the fact that the pastor had called for another meeting of the congregation this past Sunday. And I shared that with our county manager so that she could make sure that appropriate enforcement was taking place. The other community spread happened when a group of folk went on a cruise, and they were allowed to leave the cruise ship, and it is believed that they had the virus when they got off the cruise ship. Because they were all friends and they all sing on the same choir, as a result of it, at least 15 people contracted the virus. And so we cannot stress enough how important it is to practice social distancing. We cannot express how important it is that we follow the stay-at-home order, that we wash our hands. While these things might sound simple, they're really important in terms of how long we will have to go through this stay-at-home order. And then the last thing, again, is that even when we begin to see the signs that we're coming out of this, not to act in haste and have us go through this again. So again, thank you for the opportunity to share. At this time, we will move to the last item on our agenda, which is to adopt those things that were in our consent agenda that were pulled. And so I will move to, and we will have to vote on each one of these, and it will have to be identified how you cast your vote. So the first item is item 024, Revaluation Reserve Fund, pulled by Commissioner Lee.
Let me say, can you hear me?
Yes.
Thank you. Let me say thank you for affording me the opportunity to also share with the community through the consent items, as many of you stood there tonight and talked about what your concerns were. This deals specifically with the revaluation. It says the reserve fund is to ensure that counties in North Carolina are prepared for the cost of the reevaluation. And moving down, it goes on to also say to us that the Board of County Commissioners resolution to change the Mecklenburg County revaluation cycle is to be 4-year cycles. So we will do this again in 2023. So moved, Mr. Chairman.
It has been moved. Is there a second?
Second, Commissioner Jarrell.
Okay, moved by Commissioner Lee, seconded by Commissioner Jarrell. Any discussion? Hearing none. Commissioner Cotham, how do you vote?
I vote aye.
Commissioner Fuller.
Aye.
Commissioner Harden.
Aye.
Commissioner Jarrell.
Yes.
Commissioner Leak.
Yes.
Commissioner Powell.
Yes.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Scarborough.
Aye.
The chair votes aye. I think that's 9-0. Moving to the next item, 043. Grant award, Department for Homeland Security, Stormwater Services, pulled by Commissioner Lee.
Yes. Thank you. I also pulled this because this has been a major issue with Mrs. Tammy Hill that lives in the did live in the LaSalle area and community off of Bateswood Road. That's a major problem for that community back behind West Charlotte Senior High School. So the Homeland Security Science and Technical Director will be getting monies to make sure that they are able to complete and do our process in helping to alleviate some of the flooding problems in that area and other areas. So this deals specifically with Mecklenburg County, and it talks about the Department of Transportation. The Charlotte Fire Department was also involved in this. So move, Mr. Chairman, to pass this grant award request.
Is there a second? Okay, moved by Commissioner Leak, seconded by Commissioner Scarborough. Commissioner Cotham, how do you vote? Commissioner Cotham.
I vote aye.
Commissioner Fuller.
Aye.
Commissioner Harden.
Aye.
Commissioner Jarrell.
Aye.
Commissioner Leak.
Yes.
Commissioner Powell.
Yes.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Scarborough.
Aye.
And the chair votes aye. That's 9-0. Next item, 047, grant application, American Heart Association, pulled by Commissioner Lee.
I pulled this because this is a part of what's going on now in our community with those who have other issues besides the virus that's upon them. So the health department is talking about a policy, an office of policy and prevention, but I have some major concerns about asking us to support a corner store process rather than bringing in a grocery store or a mini market, and I've been asking for that. So I guess we have to settle for this until we get that. And it says it's supposed to be for 4 to 6 selected stores in our public health priority area. And that deals with the zip codes of 28208, my district, 28217, my district, 28205, yes, 28212, 28216, and 28206. I have a major issue with continuing to talk about corner stores in neighborhoods that need a mini market. But I have to go along with this until we do better. And I'm asking the manager, how far are we with a mini market?
Not as far as we'd like to be, unfortunately. We've been working on that, but unfortunately, this crisis has taken all of our time away from really working on anything else.
And I'm going to respond to that. Let me say thank you, thank you, thank you. But this has been on the agenda for a long time, and yet we're talking about living healthy and not becoming impaired because we don't have the access to major foods within our community. So I don't know how I'm going to vote to support it, but not support a corner grocery store, but to continue to try to bring in the mini market. So move, Mr. Chairman.
Okay, is there a second?
This is Commissioner Powell. I second.
Okay, moved by Commissioner Leak, seconded by Commissioner Powell. Commissioner Cotham, how do you vote?
I vote aye.
Commissioner Fuller?
Aye.
Commissioner Harden?
Aye.
Commissioner Jarrell? Commissioner Jarrell?
Commissioner aye.
Commissioner Leak?
Yes.
Commissioner Powell?
Yes.
Commissioner Susan Rodriguez McDowell?
Aye.
Commissioner Scarborough?
Aye.
The chair votes aye. That's recorded as 9-0 vote. Okay, thank you, Commissioner Jarrell. All right, moving to the next item is 049, budget amendment, Park and Recreation Hornet Foundation donation. Pulled by Commissioner Lee.
Thank you. This deals with the little libraries that you've seen in front of many of the park and rec facilities across the district, which adds books to the community. And many times they're putting food in these little libraries that's on the stand. So I move to accept this process.
Is there a second?
Accept the donation.
Second, this is Harden.
Okay, moved by Commissioner Lee, seconded by Commissioner Harden. Commissioner Cotham, how do you vote?
I vote aye.
Commissioner Fuller?
Aye.
Commissioner Harden?
Aye.
Commissioner Jarrell?
Yes.
Commissioner Leak?
Yes, sir.
Commissioner Powell?
Yes.
Commissioner Susan Rodriguez McDowell?
Aye.
Commissioner Scarborough?
Aye.
The chair votes aye. Next item is 058, grant application, North Carolina Department of Transportation, pulled by Commissioner Lee.
Thank you. And this deals specifically with the safety zone in our community for riding bicycles in the area of Arbor Glen Bicycle Playground. And they're asking that we do something about it in terms of supporting the area and make it amenable for young people to do this. So move, Mr. Chairman.
Second.
Okay, moved by Commissioner Leak, seconded by Commissioner Susan Rodriguez McDowell. Commissioner Cotham, how do you vote? Commissioner Cotham. Commissioner Fuller.
I vote aye.
Commissioner Fuller.
Aye.
Commissioner Harden.
Aye.
Commissioner Jarrell.
Vote yes.
Commissioner Lee.
Yes.
Commissioner Powell.
This is wonderful, and I vote yes.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Scarborough.
Aye.
The chair votes aye. That's 9-0. Item number 060, equipment donation, Dell Secure Works Eye Center, pulled by Commissioner Lee.
Yes, this deals specifically with the awareness for the state of North Carolina has purchased an early warning system, and this system has been donated to the state of North Carolina, and we need this for protection, whether it's physical awareness and letting us know what's going on across the country, and especially in North Carolina. and it calls itself the Secure Works. And the program being implemented would include an escalation of tasks for all events. We have a notification, and it goes on to clarify what we need to do. So move, Mr. Chairman.
There's a second.
Second.
Who was that seconded?
Scarborough.
Okay, moved by Commissioner Leak, seconded by Commissioner Scarborough. Commissioner Cochran, how do you vote?
I vote aye.
Commissioner Fuller.
Aye.
Commissioner Harden.
Aye.
Commissioner DeWell.
Aye.
Commissioner Leak.
Yes, sir.
Commissioner Powell.
Yes.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Scarborough.
Aye.
The chair votes aye. That's 9-0. Item 0, grant to National Institute of Food and Agriculture.
Here we go again. Thank you, Mr. Chairman. Here we go again talking about food and grocery stores in low-income communities. We need to do a better job, and we keep saying yes in the same zip codes where they're talking about fruits and vegetables for low-income consumers. So that's a major issue for us, and we will continue to be as long as I sit on this board. So move, Mr. Chairman.
Is there a second?
Second.
Moved by Commissioner Leak, seconded by Commissioner Scarborough. Commissioner Cochran, how do you vote?
I vote aye.
Commissioner Fuller.
That's Trevor Fuller, at large. Aye.
Commissioner Harden.
Aye.
I can tell it's getting late. Commissioner Jarrell.
Yes.
Commissioner Leak.
Yes, sir, brother.
Commissioner Powell.
Yes.
Commissioner Susan Rodriguez McDowell.
Aye.
Commissioner Scarborough.
Aye.
Chair votes aye. This time the chair will entertain a motion to adjourn.
Oh.
So move.
Commissioners, I would remind you that you received from me an email with an attachment of an attestation. If you could email me back that signed document on email attesting that you attended the entire meeting and you were in attendance, I would appreciate that at the conclusion of the meeting. Thank you.
Thank
That
you.
we do
Meeting
what?
stands adjourned.
That we send to you what, Mr.
You
White?
give us the verbiage again?
I sent you an email that already has the verbiage. You simply respond by email with that attachment saying that you attended the meeting in its entirety. That would be sufficient.
And I can't tell you now that I attended.
I need it in writing, Commissioner Leak.
I send it in the morning.
That'll be fine. Thank you.
Okay.
Thank you.
I send in the morning.
Have a good evening.
And here is my spout.
When I get all steamed up, then I shout.
Tip me over and pour me out. Oh.
It only takes a moment to make a moment.
Cheers.
Take time to be a dad today.